Every little smile can touch somebody's heart. No one is born happy, but all of us are born with the ability to create happiness.
Good morning to everyone joining us today. It's our great pleasure to welcome you all on behalf of our GD Foundation, Institute of Personal Education, for continuing professional development, transforming nurses' care, technology center, and digital innovations. In collaboration with Maharashtra Nurses Council, today Nurses of India Journal and Nurses Society. For today, we will be your host. I am Miss Arka.
I am Ms. Namrata Takale.
For this conference, and I welcome you all again.
Today's program has about 300 enthusiastic participants, 5 eminent speakers who have insight skills and experience that will be shared. I am sure this strategic professional development will truly execute a diverse spirit and will be the immense success. Now, I would like to invite 30th year students for welcome song.
Thank you, students. I request all the speakers to stand up on the dais. right of the line. Thank you, everyone.
Now it's time to felicitate our eminent speaker. I request Dr. Shailja ma'am to felicitate our first eminent speaker, Dr. Suresh Kumar Sharma sir.
Thank you. I request Dr. Shailja ma'am to felicitate our second eminent speaker, Dr. Rajesh sir.
Abdullah sir. Now it's time to felicitate observer for our today's national conference, Dr. KHARGAHR ma'am. Ma'am, we are very thankful for your valuable time. I request Dr. Shailaja ma'am to felicitate Dr. KHARGAHR ma'am. Thank you, ma'am. I request Mr. Jayan sir to felicitate our fifth eminent speaker and our beloved principal, Dr. Shailaja ma'am.
Thank you. Now, I request all the eminent speakers to smile with us. Now, here I request Dr. Shailaja, Principal of Dr. G.D. POL Foundation Institute of Nursing Education for welcome address. Good morning, madam. Good morning. On behalf of Dr. G.D. POL Foundation Institute of Nursing Education, Trustee, Chairman Sir, and all the teaching faculties, I would like to open today's national conference. Now, as you all know, you all are gathered over here for national conference. Topic of national conference everyone is aware about: transforming nursing care. Definitely, transformation is what changes. Okay, some innovation, standards. These all things are required in our life. Then definitely, throughout the day, you all will gain some sort of knowledge towards nursing care standard digitalization. I would like to welcome all eminent speakers, and it's really great pleasure for me that all these eminent speakers have arrived. And regarding delegates also, with your busy schedule, you all have registered and you all are attending this conference. Really, I'm assuring that throughout the day, you all will gain great knowledge. You all will gain and you all will develop skill towards our nursing profession. It will be great national conference. Thank you all and all the best for attending this national conference. Thank you, ma'am.
It gives me an immense pleasure to introduce our first speaker and our beloved principal of Dr. Charitable Foundation Institute of Nursing Education, Dr. Shailaja Dashaya. Ma'am has completed her BS Nursing in Pravra Institute of Nursing. Ma'am has pursued her MS Nursing in OBGY in 2010. Ma'am has completed her PhD from JJTU University in 2022. Ma'am has MA in Psychology from IIT Mumbai. Ma'am has published many international and national publications. Ma'am is healthcare nurse, TNI member and exam coordinator, paper setter, examiner, analysis inspector, and now NAT coordinator. Over to you, ma'am.
Now, before starting the sessions, you all might have recorded patient's care. Am I right? We all are doing recording of our patient care, our nursing care. How are you doing this recording and reporting? Yes? Yes? Are you all aware? Yes. Are you all enthusiastic to listen? Yes. Okay. Hope everyone had their breakfast? Yes. How you all are doing it? Can I tell? There are much more submissive people for the registration that I have observed. Yes, how you are doing it? With paper pen? Yes. Are you all? Yeah. Alright. Without paper pen, now recording and reporting has been started. It has been started. Everybody is aware about it. Okay. We'll see the terminologies towards digitalization. Now EMR. The word itself suggests electronic medical record. Now, electronic medical record. It's a digital version of patient's record. In that, you all can record patient's medical history, patient's demographic data, investigation, treatment, certain lab results, or certain prescription. These all things will get recorded in electronic medical report. Now, what is the purpose of it? The word itself suggests it's a digital repository. Then definitely we have to record digital things online. That is very much important within a particular practice of healthcare setting. Now, we will see another terminology also. So before we will next terminology, EMR, electronic medical record. It will be within that practical setting. It cannot be transferred or it cannot be shared with another setting. But definitely, it will record the medical history or all the details of patients. That is very much important. For example, Mr. A has got admitted in a hospital with the complaint of pain in abdomen, vomiting, fever, whatever things are. These all things get recorded in that particular hospital, in that particular setting. That is electronic medical. Now, what are the contents of it? As I told you, if patient comes at the doorstep of hospital, then definitely we have to try to see about patient's demographic variable. Okay, age, sex, occupation, all these things we are going to see. In that recording, patient's demographic variable. Second, then medical history. Everyone is aware how to collect the medical history. Whether he is on any tablet, diabetic, or any hypertensive, what all that. Chronic and at present acute, what all history patient has, what chief complaint patient is getting admitted in the hospital. These all things we need to observe. With medical history, with that purpose, that content will be there in EMR. Then diagnosis. Definitely after collection of history, not only medical, other histories also get collected, and then diagnosis will be done for the patient. If patient has got admitted with pain in abdomen, fever, vomiting, it might be doctor may diagnose it as appendicitis also. Doctor may diagnose based on the investigation report, based on the patient's complaint. Doctor may diagnose it as a cholelithiasis. That diagnosis will be done. That is a medical diagnosis. That is very much important. Then treatment. Based on that, there will be certain prescription for the patient. You all know what all the common prescription doctors are giving it. medications. Allergic, when the patient has any allergy towards certain medication, that will get observed. Then they will go for the investigations and certain imaging reports. Ultrasonography or another imaging will be done. These all will be there under EMR or electronic medical report. What all the recording is being done over there. Then functionality. How it functions. If we are recording it, definitely utility or functions of that is very much important. Then it will be. How it will work? Definitely healthcare providers within that health settings, they will observe, they will assess, they will analyze the patient's recording and reporting. Then definitely they will get the track over there. What all data has got recorded, they will track it, they will observe it, and based on that, patient care will get provided. That is very much important. What all patient care is required to that particular individual, it will get analyzed and assessed, based on that care will be provided, and then will get functions once. These all things will get recorded, then medications, then the lab result, then what care is important, it will get analyzed, assessed, and it will get implemented towards that particular client. That is the functionality of EMR. What are the benefits of EMR? Definitely, if you are going for the digitalization, how it will be beneficial for the client, for the institute, hospital, and for the employee also. That is very much important. First important benefits, then definitely what are traditional paper pen we are using it. It will go out and we will go for the digitalization. Second, it improves the accessibility. It will be easily accessible towards that particular setting. Again, I am using this word. It will be easily accessible towards that particular hospital setting only. It is not at all transferable. That you all supposed to remember, because another terminology we have, that's why I am telling you all, EMR is only utilized in that particular setting. That's why it will improve the accessibility. Easily you can access the patient, what all things are available, what is the patient complaint, why patient has got admitted, with what complaint, what all investigations has been done. These all things easily accessible. That is very much important. That's why it improves the accessibility. If hospital with the 250 bedded, then definitely which all patient has got admitted, that accessibility is very much important. It improves the accessibility in the hospital setting. Then better organization. Definitely it will organize properly how the tracking system is necessary. That organization based on patient's demographic variable, history, then what all treatment, investigation, this organization will be done in electronic medical report, and it will be organized properly, and healthcare providers can access it in easiest way. Then enhance communication among providers. Anyhow, while taking rounds, we nurses, we are giving handover about the patient. Doctors, they are also discussing certain things. But our mind is not a computer mind, which we can remember each and every aspect. With this electronic medical report, definitely it will facilitate easiest communication. Person can access, they can open the code or they can open it and they can access the patient's history properly. That's why it gives proper communication among healthcare provider. Accordingly, what all prescription has been done, it will get recorded and person can access it in easiest way. That is very much important. That's why it gives communication. Increase efficiency. It gives efficiency. Means it provides quality care to the patient. As everything will be recorded in easiest way, then definitely it provides a quality care. Healthcare provider of that particular hospital setting, they will observe, they will assess, analyze, based on that, the proper communication, patient will get the proper care and it is efficient. Then reduce error. That's why I put it in bold. It reduces the error. Anyhow, in one ward, suppose it's a medical ward, if there are 40 patients, it will be very difficult on which bed number 1, which patient has got admitted with what complaint or with what disease condition. In bed number 6, which patient has got admitted with what complaint? It will be very difficult. But if we have the component or digitalization of it, easily we can access it, easily we can observe, analyze, and as a nurse we can provide the proper treatment or all vital signs what we are supposed to do for the patient. That we can analyze it. Due to that, errors will get reduced. There will be errors, but errors will get reduced as we will provide efficient care to the required client. As per there, this is condition. Okay, so these all are the benefits of EMR. Hope you all have understood what we mean by EMR. What are the purposes, content, these all things you all might have understood it. Yes, only one thing you all are supposed to remember, it is related to particular hospital setting only. It is not at all changing or transferring the information to other hospital or other stream. That you all supposed to keep into mind. That is EMR towards that particular hospital setting. Now next terminology we will see EHR. Word itself, electronic health record. That is very much important. Over here, all the information towards authorized person, that information should be accessible towards the authority, towards the healthcare providers, and towards the organization. Definitely it will share information. It will get shared with other social schools. EHR, that electronic health record gets shared with the organization and information towards that patient is getting transferred to other hospitals for second care, and then it will get shared to other health streams or sources. That is called as EHR, electronic health record. Now what are the purpose of it? It is a centralized digital repository of health information which is accessible to various healthcare providers. That is very much important. Authority, organization, administrator, all healthcare employee, including if the authorities or administration may get transferred or shared to other hospitals only. That is one of the important aspects of EHR. As we see EMR, similarly there will be a content over here. It will get recorded, patient's demographic variable, then patient's health history, including patient's medications, treatment, lab information, health information towards the patient. These all will be the content for the EHR. Now what are the benefits? Definitely, as I said, easy decision making towards authority. That is the one of the important aspect of this. Towards authority, they want to make certain decisions for the client. It will be the easiest way. It improves the efficiency. Reduce the medical errors. That is very much important. And one more important aspect in enables data sharing. And it will be efficient towards which care is important, that they can coordinate with that patient getting the proper care and the patient certificate maintained. Along with that, where confidentiality aspect that can also maintain over years so that patient certificate that increase efficiency. It increase the quality patient holistic views or holistic care towards the brand is efficiency towards the care. Now, what do you think? The difference between EMR versus EHR? There are 2 points: scope and data. Scope. EHR has much more scope as compared to EMR. As I told you, electronic medical record, that is only accesses with that particular healthcare provider, that healthcare system. EHR can be accessed with the healthcare provider, with the coordination of healthcare provider. Then definitely EHR has much EHR, that is electronic health record, which has much more scope as compared to EMR. It is very much important that the information can get in the that is very much important. That's why EHR has more scope as compared to EMR. As I told you, EHR patient system, which all patients are there medical record, it will get interoperated or will get shared with other healthcare providers. So that data sharing with the coordination, with the discussion, proper decision making will be there, and patient will get quality. EHR gives much more data sharing as compared to EMR. This is the basic difference between EMR and EHR. Hope everyone has understood the difference between EMR and EHR. Now we will move to the next terminology, that is PHR. What stressors? Personal health record. Anyhow, in nursing we have certain tips which we need to follow. Confidentiality, we cannot use certain policies. Similarly, personal health record. Patients can access their health record in easiest way. With what why they are admitted in the hospital, which treatment that they are getting, which treatment they are supposed to refuse, which doctor they are supposed to select. These all things we get in personal health record. That is important. It's a centralized platform for individual to store, access and share their health record. Control will be towards the person or towards the patient. That is his personal health record. Key features of personal health record, it will be centralized and accessible. Centralized, that means it will be the key will be handled by the patient or that particular individual. That is centralized and accessible. It will be accessible towards that particular person. Along with his communication or his permission, it may get shared under EHR or EMR. But over here in EHR, that will be accessible only towards that particular individual. Personalized consent, as I told you, patient has right to refuse, patient has right to access. These all things will get resolved in personalized control. Then improve communication. It improves the communication. Rather than discussing, like healthcare providers may discuss towards the client with what they have got admitted, what all things are there, what treatments they are getting. That may get discussed with the healthcare providers. But along with that, person or the patient, they are accessing their healthcare services, then definitely it improves the communication towards that particular individual. Along with verbal communication, non-verbal communication, these all things get preserved in this improved communication of behavior. The enhanced health management, it gives the health management properly. Healthcare workers, they will provide care to that particular client. Patient safety, care, everything will occur. But along with that, patient, this is what that particular medication, what that particular doctor, that particular surgery, that patient can easily access what things they are attended and what they are supposed to undergo, with what surgery, with what treatment. They might not be understanding, they might not have knowledge towards it, but they can access with personal and with that they can discuss with the doctors. Then it will enhance the health management with that particular individual along the healthcare variety of over there persons whatever data will get stored along with that person can access another digital things with that variety of data will get stored and person can resolve or not. These all things will happen. Then include continuity of care will be the continuity of care over here in the personal health record. What are the benefits? It is the control. As I told you, control will be towards centralized, the control will be towards that person, towards that individual. That is very much important. That person can access their information in his digital storage. All the things, as we are in 21st century, definitely everyone has smartphones along with that smart computers. These all things are very much important. There will be that storage will be in digital, online. Then comprehensive health information. Everything will not be discussed by the healthcare provider to line. Definitely, what are things got recorded, they can get the comprehensive health information towards their health. Enhance communication, as I told you, empowerment as it is towards that person because it's a personal category. Use empowerment power towards that category. Increase access. These are the benefits of EHR. We have covered EMR, electronic medical record, EHR, electronic medical record, and PHR, that is personal health record. All goes towards the digitalization, online storage. Only the things EMR it will be towards that particular setting or hospital. EHR it will get provided data sessions to everyone, all the hospitals, everyone will get provided. That is very much important. And PHR that is towards the person. That is very much important. Now we will cover our last terminology that is HMS. HMS, the word is Hospital Information Management System. Then definitely everything will be online. Whether the rooms are available or not, whether that patient should get admitted or not, whether equipment are available or not, these all things will get managed in HMS. That is very much important. That is Hospital Information Management System. It's computerized systems that manage all aspects of hospital's operations. All aspects, all hospital operations, including patient billing, admission, patient scheduling, or any other things. All these will get digitalized towards HMS. What are the projects? First and most important data management. First, patient record. In the HMS, patient record, patient electronic records, and efficient accessibility and patient getting digital again they get admitted with any other company that get also that is patient records. Then operational data. In operational data, tracking key indicators towards room occupancy, efficient equipment, availability of equipment. These all things will be there in operational data under HMS. Then the policy decision, providing data to support evidence-based policy. Evidence, ongoing what things are present. What evidences are present. Based on that, this decision will take that policies or the hospital management area. This decision, that's why it gives the policy decision. There is streamlined healthcare operations under HMS in that patient registration and management. As you all know, everything will be streamlined by HMS and everything will be operationalized in the digitalization function. Then billing and invoicing, these all things will be automatic billing and claims processing. These all things will occur rather than doing the paperwork. Everything will be operationalized and billing. All things will be there. Pharmacy management, that is managing pharmacy operation, medication, like everything will be there in digitalized process. Enhancing health quality and efficiency. Definitely HMS enhance health quality and efficiency with improving decision making, what all the decision and which situation evaluate and best on that orders of such equipment and optimizing resource utilization. Total is available. Definitely utility is very much important and improves the resource allocation and utility of that resources available in that particular hospital setting. That is the enhancing the healthcare quality and efficiency towards subjects. Now, what are the benefits of subjects? First, manages patient data. Definitely manage the patient's recording, reporting, their history, medication, treatment, everything will get managed properly in which on what they are supposed to be there, that will get planned properly. Streamline operation gives proper functioning towards pharmacy, medication, quality care, or nursing care. These all streamline operations towards policy. Improve communication with this online, easily accessibility will be there, and it will improve the communication towards the client, towards the healthcare provider. Enhance decision-making as authority or authority persons will handle and take the decisions in easiest way. Reduces costs because over here resource allocation will be there, and definitely it may reduce the cost towards operational functioning. Improved patient care, quality and comprehensive patient care will get provided at the HRS because it is planned and organized properly. Enhance efficiency towards all the healthcare workers and reduces the error right there. It may get reduced as easy accessibility towards online functioning will be there at the HRS. Better communication and cost setting. This is all about terminology towards EAR, EHR, PHR and HHS. And down towards it, yes, and it has it down. Hope I have tried to clear at least concept and words these all terminologies. EAR, electronic medical record, okay, towards that particular streamline or hospital setting. EHR, electronic health record, digital health record, towards all the patients, but it will get shared. Data will get shared. It has medical scope, then PHR, personal health record, towards that particular individual. He can access it. He or she might be having some control over their health record that is important, and HMS, that is hospital information management system. We have covered the purposes, content and benefits of that particular terminology. Anyhow, as we survive in 21st century, many more hospitals have started the digital online functioning of the patient's record. But still, pen and paper is there in the hand. Definitely manpower will be less towards the digitalization. But without manpower, hospital cannot function. That is also one of the important aspects. Any doubt? Thank you all for patiently listening.
I request Dr. Supriya Pradhan ma'am to give appreciation to Dr. Shailaja ma'am. I request Ms. Preeti Naik ma'am to give appreciation to Dr. Shailaja ma'am. Thank you, ma'am.
It will be my pleasure to invite our speaker, Dynamic Personality, Dr. Suresh Kumar Sharma. Sir is a medical and nursing performance specialist at C. Sir is a medical nursing program expert for Sir is G20 delegate for medicinal health group March 2023 under G20 India CSS. Sir is auditor for ABDM Health Association Quality Council of India. He serves as assistant professor at psychiatric nursing, Government of Maharashtra Institute of Mental Health Access Hospital. Sir certified in ISO and data management for ROC app during COVID-19 pandemic. He is a Quality Council for COVID-19 warriors by Indian National Institute. Along with that, Sir is awarded as a Young Dynamic Researcher from Phoenix International. He is the author of book Baga's Clinical Nurses and Anti-Medical Management by Shakespeare Publishers USA and Pre-Preparedness in Medical Mental Health and Artificial Law. He is the author of several research papers published in Scopus, UGC Care, List and International Journals. Over to you, sir.
Hello. Good morning, everyone. So ready for the digitization? Yeah. Can you please see the size of the screen? It's really. Good. Is visible right? Last? Yeah. So when we are talking about the digitization, it's not only reducing the nursing care, whatever human touch, we are giving to the patient. That be same always. Okay. Now we are talking about the digitization. Wherever you go, including any of our homes, banks, when we want to transfer the money, previously what used to have happened. We need to go to the branch, fill some form. Then we need to do the net, right? Now what we are seeing the next to the payment, we are doing one payment Google Pay. It is 1 million. This is it. Yes. Then we are talking about exams and homes. Whatever exam you fill. We fill in the paper and send it to organizations, right? After that, what we have done is all online. Exams is conducted online. Whatever the forms is together instantly in the systems, right? So why not in the health? When I was 2018. After that, NATIONAL health policy come in 2017. When you are reading the ministry about the test in the country, there are many obstacles from the state ministries. There is no system, infrastructure, how it will be done. So that has a lot of there. He told it's not a one-day task. It will take years of hours, but we need to start in any way. If you want to reach anywhere, we need to start. Right? Then 2019 has started NATIONAL, National Health Blueprint. How the ecosystem of the country will work in the health. Then now you have heard about the ABM, Ayushman Bharat system. Yes, have you heard? All? How many you have I? Yeah? So I can see Ayushman Bharat health account number. Yes. So now see, we are professionals. We are sitting here. We don't have our ID. Means 50% population I can say they have, but not all. So like now it's 7 years after ministry notifications. So it's about sensitization, learning the thing and implementing the things. That is the health. And same when Madam called me for the speaker this morning, I am conducting all things. So what was my view? It should be in the form, when we are starting the journey, our nurses know what is our role, how we will upgrade, how we will become the digitization. Without digitization of the nursing, digitization in the country is possible? No? Because who is the backbone of the hospital, the nurses. Right? So, then in that motto, this conference has been organized. Okay? So, digitization is upgrading ourselves in the digital field. Same nursing area that can be increased by spending more time in the same rather than the papers. Okay? It's like then now when we are talking about the digitization, there is a need of nursing terminology. How many of we had prepared the nursing care? All, right? We all prepared. And we were really struggled to get the diagnosis. When we are in the world, working in the world, and we need to remember what are the scenarios I studied, running to libraries, then searching and doing those things. Yes? So how we can actually identify the home? So what happened? Ministry has released a notification in 2013, 2060, they recommended primary clinical terminology society. That is the capturing data. That include all diagnosis is used across the world. World is diagnosis. You can be that can be your hand in mobile. For that, ministry has taken the license to use in the country, so it is available free use in the country. Now the cost of license is $5. Ministry is paying the fees, and we are using it. When we are not using it, right? So we need to use it. How do we use it? Okay. So exercise nursing terminology. What are the nursing care, nursing outcomes, and including all terminology, any diagnosis procedures, all are already right? All are in the HMIS protocol. In HMIS protocol, just you need to enter nursing procedures. I want to say fever. Just I type the fever, all diagnosis from related to fever. Just you need to specific it. Then nursing outcome. One is there. Nursing intervention. Nursing intervention just need to enter active management, medication, and therapy. That will come. All will come in the doctor. And nursing plan will be prepared in that system. No need to write, sit and write the 10 days. It will be 10 lines, including all instances. And it's not like that we are reducing. We are reducing the efforts in writing the plan, but that efforts we need to give in the nurses here. Yes. Nurses are the nurses here. Not maintaining the paper. Right? That is the motto of the ministry behind the adopting nursing terminology. Next, please. Why is happen? Because rises of the demand. Time is very less. Second persons. Yes. We need to work more than the year other than the persons. Then challenges in the traditional models. Same paperwork. Mostly we are behind the works. They like a nurse in the ward. He medicated around 15 researchers. Am I right? Yes. 90 and entries, all these things. But it should be in the computer system and it will be the old digitization. So more time we can spend in that. Next. Then key technologies which are very necessary for driving the digital transformation. EHR has continued. What is EHR? So there are three terms: PHR, EMR, and EHR. PHR is personal health record, which we are maintaining in our home. We go. Yes. PHR is then EMR, any medical department. Then EHR, including both EHR as EMR to EHR. That can be transferred from one system to other system with the same meaning as they had inherited. That telemedicine, as in 2002, telemedicine software has been released. Telemedicine should be used in the country, but that is not approved by the ministry. As COVID hit the country in March 2020. 23 was lockdown, right? 24 we had work with the necessity and telemedicine guidelines has released instead of that day to use in the country. Now telemedicine guidelines PG has been released and all telemedicine procedures can be done that are limit guidelines. So nurses are aware of these guidelines and their roles will be identified. Okay. Then AI machine learning. Next session next time from Dr. Rajesh about the AI skills how we do. Next please. Then DNAs and IoT. People are using the digital biomarker, right? What is AI using? So these all data we are using all watches and systems that will be linked with your Aadhaar ID. Not now. But in future, is there, all variables will be linked with your Aadhaar ID. They will check your guarantee status. Like when you are visiting hospital and you will enter your Aadhaar ID, your overall health report will be distributed to that listeners. Here, very important is that consent management. It's not like that any person, any clinician can see your health data. Because it's your personal health data. And what ministry says, owner of the data with the patient relationship. We want to disclose, we want not, he will not. So how we manage? We have our app. You can download from Google Play Store or App Store. Okay? That's any clinician you will use it. They want to see your report. That is coming in your health. This clinician want to see your this health report till your time of process. If you want to agree, then only we will see. And I will with the specific time periods, not whenever you want. Okay? So that is about the variables and IoTs. Then the question, why are we doing digitization? It's about data analytics and clinical decision support. Whatever data we are changing, it should be used for the wealth of the country. We can change our health trends. If my own health data from birth to till now is maintained, I can say in the next 5 years what is going to happen, what is the predictive analysis. If my blood sugar is running last 9 years, then I can be suspected of diabetes. And I can prevent it. That is the preventive system of treatment. Yeah? That is by the blockchain. Next please. Now the role of the nursing technology. When we are talking about digitization in the health, obviously without nursing technology. So how the nursing care will be done using the nursing care class. That is not the nursing technologies. Recommended nursing technology by the American Associations are Nanda, we all know Nanda diagnosis. Okay. Now Nanda is there any full form? Not is demolished. Now it's called Nanda one. Okay. Then NIC nursing intervention classes or capturing the intervention of the patient. Then NOC nursing outcome classification or capturing outcome of the patient. Then sonometry or capturing of all nursing diagnosis, interventions, outcome, whatever clinical term become in your mind, it will be the sonometry. And India is a micrometer. So any term, any browser, you can use it freely and you can use it for the data capture. And here the administrators are also there. If any hospitals are involved with digitization, then they are from the nursing department. What we need your system. So we need to rise our demand. We need a nursing diagnosis. Just nursing diagnosis we need to be entered in the HMIS process. Any hospital who are adopting HMIS solution as a nursing officer, nursing in charge, veterans, principals, professors, we need to demand where we will enter the nursing care in this system. As we will ask, that will be the university and we will provide the old access in your just request of the users. Because ministry is a governing body, not a providing body. They will not provide it. You need to ask. Right? Then interoperability. Interoperability as well as whatever data which you are capturing in the OPD, when transferring to OPD, the same thing, same consent, same momentum will be transferred to the IPD, OT, daycare, wherever the patient will go. Across the country, he can get that data against this That is the interoperability. So main aim for this organization to achieve the interoperability across the country. Wherever the patient will go, just behind the our old database, whatever has been entered in the life pharma section. Next. The benefit of nursing license, how will it get? Obviously, it will be the coordination. Again and again, we no need to enter the data. Yes. Open assessment when we are assessing in the IPD, again we are doing assessment. When again assessment. It will be done, but all data will be that is with our. Then better decision making. If the patients have all and goes, if they are like patient is admitted in the ward, patient is conscious, right? When I enter our IPD and this is all and the report has been hatched in my system, I can see patient is eligible for service. I will not enter the diabetes health and patient. Because patient is conscious. And if I will, if the data is not available, then I can enter the yes. So this type of decision making can be used the Next is detection making. Obviously, because whatever data we are assuming the database can be entered and it can be verified by the professionals. Then competitiveness, again, you need to do the analysis. Diagnosis. Because from one hospital, if we are going to another hospital, again we do the whole analysis. Right? Because that we are contending. Whatever test report we have, it is our home. We can carry. I am the and my whole health reports are in the home. But something happened to me and I am going to hospital Delhi. Then again all investigation is due because that reports are not with me. But if it is in the digital format, against my IPD, all records can be fetched. Then the reporting has been improved. Now what we do? We are doing the nursing care our home. But nothing is recorded. Yes? As all nursing care we are giving, but it's not recorded anywhere. So whenever we are working, what nurses are doing, where is the nursing code? We are not getting it. If it is in the system, it will be this is the nursing care plan, nursing care is done by the nurses. Next is then EHR standard for India. That I told. This journey has been started in 2013. When we has notified EHR standard for India 2013 and these guidelines has been revised in 2016. There, Somerset City has been located the primary technology across the country for data capturing in any area sources. Okay. So any HMI solution you are adopting in your hospitals, just to give you tell them, this system comes from the EHR guidelines based by the ministry. All will be there. Any help if your hospitals and IT department ask if you don't any help is required, you can contact the ministry from two persons of the ministry come there and they will extend their service without charge. It's all from the ministry without charge. Next, please. Then this is a ecosystem. Ayushman Bharat Digital Health Mission. What is the role? It's vision behind it, universal health coverage. In 2022, it has been rolled out by the Prime Minister of the Delhi. Next, please. These are the five components of Ayushman Bharat Digital Missions. First, you can see it is Aadhaar number. We also have the Aadhaar number to fetch our health codes. And whenever we are going to the community students are coming. Madam, please. Students are going to the community codes. We need to guide them aware the local community about these applications. Okay. And also in our community, whenever we can adopt and aware our community, use the Aadhaar number. Any other thing you are going, if they are asking Aadhaar number, that data will be cached. Then HCR, health care professional. Health professional is maintained by the Ministry of Health. Nurses and doctors need to be registered there. So as a professionals, we have our registration council. Same we need to register in the HCR, health care professional. That will be recognized by the Ministry of Health for the wealth of the country. Then health facility registry. And any health facility, including hospital, diagnostic centers, they need to register for the Ministry of Health. Then unified health interface that will be used for data capturing across the hospitals. Then Aadhaar mobile applications. We also have Aadhaar in our mobile for the consent. Because if anyone in the country is using our health code, we will be notified. Your health code is accessed by this person's hospital. Are you willing to then give the consent? If you are not willing, decline. They will not use it. Yes, it will be used. So you can avoid the misuse of your health data. Right? Next, please. This is your please. Now diagnosis. We are talking Nanda International. So if you talk about Nanda International is a technology which is used for the nursing diagnosis. And this technology has been included in the software. If we are using software, Nanda diagnosis will come in the system. Next, this is the example. This can be available in the software. Like this is for knowledge. Whatever diagnosis we feel in the software applications. Next, please. And analysis for the interventions and interventions. Like these are different Nanda for diagnosis, analysis for interventions, and also for outcomes. And ICA for the problems and interventions. These all diagnoses are covered over the software. Okay. Like in emergency pain management, in interventions, pharmaceutical code if you see pain management or managing the pain, both are same. If in the system we are writing pain management and others are writing managing pain, so both meaning the same. So computer will detect this is the one intervention. There will not duplication of the data. Like about the heart attack, MI, myocardial infarction, many data are there, right? So clinicians or nurses can write anything. He can write MI also. She can write myocardial infarction also. They can write infarction. But and same. Next, please. For outcome classification, right? Never like scales which we are using, pain which we are using. Okay, that can be using the NOC, and it will be coming in the software. Next, please. ICSP, International Hospital List of Practice, that is for the diagnosis, interventions, and outcomes. The overall component of our surgery plan can be covered with this, and this is also included in the software. So what is about? Next, please. So main domain of this software. whatever you are doing, all nursing diagnosis, all problem can be used can be filled by the Stromed, and it is available across the country. Use in mobile also. You can type Stromed International. You will see the browser. You can see the old size in your hand, and you can get the system. Also, it's done. This doesn't look yes, black. Challenges and barriers. If we are adopting the new things, obviously we need to face this. Yes, that is methods. Assistant change, and we need to learn about the computers and the data, how it works. But as we are typing in the that is speed. That can be we can learn systems also. At least giving care to patient here and writing that things. I need to go to the administration. It's very important. So it is that can be here. That is very easy. Next, please. How we can adopt it? First of all, training and capacity building, which we are doing now with the MNC. Yes. Many training organizations, councils are organizing, health bodies are organizing. Ministry is also giving. If any hospital wants to conduct training regarding all these guidelines, you can give it to the person from whom they will come to those organizations and they will all training will be given. Then you need to ensure that EHR support means any HMI solutions which are developed in the country. What is the process? We need to rise our demand. We want to enter the nursing here in a digital solution. HMI solution. Yes. Otherwise, there will be no provision to enter the nursing here by the because we need to ask. Obviously, right? Then after guidelines has been revised by the ministry now by the NATIONAL. Again, we are going on the ministry. Just we need to read the ministry adopt the guidelines are available and useful for the nurses. Then data security. Ministry is also developing the data security across country. Then will be all health data will be captured. Now the data and to capture retail data, which is the hospital only. Clinics also provided. But any patient in the country, they can demand their reports against the POL. Any health providers. Now we will discuss as the patient education. Whenever we are getting a chance, aware the patient about the digitization, how you can use it, how you can create it. These are the things. Next is future trends. Benefiting of your organization, it will be the predictive. We can do the predictive analysis of the data. Okay. Then virtual reality environment years, growth and personalized care and preventive care. We can adopt the trends in the healthcare profession and we can adopt the work. Next please. And as how to do this. Next. Now the questions are ready. Are we ready? Next please. You can see our syllabus by the council. In the undergraduate program, we have these are the practical hours regarding the computers. Then health informatics now subject has been added in the first year. So we need to focus added. There also you will see that productivity, HMI, yes. Then nursing informatics undergraduate not there, but in postgraduate 10 years and practical hours. Next please. So next part we need to do, we need to adopt a nursing informatics lab and to train the future nurses. how will will work, how will you enter, what will the ESR, how the ESR will look like, how the ESR will look like, how the EMR will look like. That whole training and this whole layer should be established here. Here we have in charge from simulation level, I is there, right? This type of layer, like in this institute, there is one layer which is so that type of layer like simulation, right? But for nursing implement also this type of layer should be established. Then only we will learn with the hands-on, right? Next, please. The function of nursing informatics is to train nurses, giving the hands-on informatics. The areas can be adopted and enhanced. Next, please. How the nursing profession can contribute? We can contribute by doing various nurses and identifying nursing in informatic gaps in the healthcare, digital healthcare system. This type of research are happening nowadays also. Now persons are starting to do in the nursing informatics research. They need to do more researches. What is the gap? What is the role of nursing analysis? Is this methodology sufficient? We need some more advanced ones. We need some approvals. We use the nursing analysis and give and take the 20-second your prepare a nursing plan using this terminology. If you feel again, this diagnosis is not found. Nothing intervention I want to give you, but it is not available in the system. Give the explanation. Or you can medicine abide to provide you all diagnosis intervention which is not available in the healthcare. If it is not available, you will request a mail is there. You can get the reply within 24 hours. Yeah. Next. Then next. So it's about this residence and take out. Please.
So my name is Rashi. I am from Kargahar. My question to you is, actually when I talk about the budget of health, first function is about trying to security concerns. So and as far as our health system concerned, it is very much important to safeguard our patient's record, right? Patient's information and whatever is taken. So how do you illustrate about the unauthorized access to CGT or hospitals?
They are sharing the pics of that taken. Many times I have seen, and these scores are in also black also. Sometimes these scores are taken by the six and uploaded. Now I will so for that, what happened that our application, our number. And even if the data is recorded in any project, that will be the project. That we don't know how without the permission of the hospital. How the permission will be taken? A person has been treated in the hospital is there here. Now patient in the next hospital there. He want to access his report. What will you do? In next hospital, he will give his Avan. Then, from that hospital, the request will come to that same application. In that, I want to access your records from your hospital about the prescription. We can get it. It's not like full text. If you want prescription, if you want MRI, only MRI. If any investigation, any nurses knows that we can do. So, this report will be fetched from patient will give permission consent to you that I want to access my own personal information till that date. Patient is admitted in the medical hospital for 7 years. So 7 days. And then he will request till this day, 7 days, that hospital can access the virus response and Global Foundation only for 7 days. Okay? After that, as time over, that record has been break. That will be seen in the report, and the new report has created in the Max Hospital will be with the Max Hospital. For that, Ministry has guidelines, privacy and security policies in the international confidentiality. If any custodian will breach this confidentiality, it will be the fine of up to 2 crores. So that is the second role. And second role, when we are putting health data in the files, papers, we can see in the world, all files are the papers. Anyone can come and access. Nobody will ask me, right? Second, हम पैसे ट्रांसफर करते हैं from one to another activity. That file is due to transfer, right? Go with the vaccine. Or that file we can get on the status of vaccine. Yes, many patients in I was in some hospital. Many patients have good of the file. Yeah, what is it? So how? So what is our system? Patient can't take if you so like both are there. Infrastructure finally renewed and policies are also there. And the yes.
Your presentation was informative, engaging, and thorough. It was clear that a lot of thought and appreciation in your talk, and it showed. Now, I request Dr. Supriya Kadam to give appreciation to Dr. Suresh Kumar Sharma sir.
Invite my first speaker, dynamic personality, Dr. Rajesh Kumar sir. Sir has completed his undergraduate education at SMS Government College and MS Nursing at prestigious Rajkumari Amrit Kaur College of Nursing, affiliated University of UK. He earned his doctorate degree through the Indian Nursing Council Consortium with collaboration Rajiv Gandhi University of Health Science, Bangalore, Karnataka. He has authored over 90 research papers in Eastern national and international journals, indexed in PubMed, Scopus, Web of Science, Medline, and others. His work has achieved H-index of 50 and I-10 index of 79, reflecting the significant impact of his research in nursing and healthcare. He is the author of the highly regarded nursing textbook, Nursing Research and Statistics, JP Brothers and Medical Completion, and Essentials of Psychiatry and Mental Health Nursing, first and second. He is a faculty for Advanced Trauma Care, nurses certified at Tantau Hospital, Singapore. He is a certified faculty for basic life support by the American Heart Association. He is a postdoctoral research at Sigma Nursing Research Conference 2019 in Scotland. Over to you, sir.
I told you exactly here today. Since I hardly come to Maharashtra, maybe third time I'm coming, but it's truly amazing to be here. All time whenever I come, I find that the people have good spirit of doing professionalism and you are all like that. I sincerely appreciate once again the previous two speakers who talked very nicely about digitalizations and KHARGAHR, electronic records, and especially the terminology things. Dr. Suresh very nicely highlighted how it has to be developed, how it is in process, what are the challenges we are facing. But definitely, beginning is always hard. You must understand it. When a child born, it's a very difficult process. But after birth, everything will become smooth. So beginning of life itself is very difficult. So we have to understand that beginning of this process also in the similar way. If I talk about this system, I think that we are lagging somewhere. But still we are trying to compete. There are many more challenges. Since I have been a couple of times in US and other Singapore and other European countries, and I very closely deal with healthcare systems. So I know that at the first time experience is what we are following, what we are following. If we talk really about paperless, I do remember the visit for Singapore, where they are not having any pen or pencil or copy in their board. You will never find it. All nurses have their own app. Every patient, where in their own app list. They have mask monitors, mask systems. They are whatever they are captions at that moment of time is completely going to electronics. And if a doctor sitting, miles, thousands of miles from that particular hospital can live see the patients, what is going on in my patient. They don't need to carry any investigation report in their hands, any notebook or any other, what we are used to carry. And I truly appreciate that system is in India. But somewhere yes, we need to support ourselves and we need to support the system because we are software somewhere because we are thinking about the largest health professionals around the globe and trained professionals, I must say that. And we should be behaving more professionally and more responsibly to support the things so that the government can take over and definitely it has very what it has been discussed in the last two sessions. It has much more benefit than I need to say. So I will tell you, I will share my experiences for another 30 or 40 minutes, and I feel like you should also share what you are experiencing at your healthcare institution. And I will share the journey that what I have learned from the distance learning, and what is the few things that we feel very, or we take it very casually, and they take it very seriously. Very few things are available. These are the two things I like to say, and I must recommend, must say that you must have good content in study. If you hardly find good content in nursing, it will be really difficult to find or to make yourself the more professional in the future life. So always read the quality content, whatever they publish by the quality publishers, and what they are publishing, what definitely have their own rating. But whatever is internationally available, definitely having more work. And in the same way, I feel blessed to have these two wonderfully written titles. And I get a lot of appreciation from the user side, stakeholder, from the academic all over India, even some of them from abroad. So thank you. Now I start session, please. Okay, so we will discuss those things like virtual care nursing, what are the and mobile health challenges, what are the benefits again, mobile health, artificial intelligence, and what can be done. So these are the few things I would like to discuss. So few of the content already being covered by Dr. Suresh very nicely. I am very right now I already have since being government sector, we have many things to comply. So we have ABHA application as well, but so far I have not known this kind of consent agreement is required, and then your record gets data privacy is there. But see how your data can be misused that you cannot even imagine. If you are thinking your life is a private, you are private person, you are in nuisance or get yourself examined. If you have mobile phone with you and you have registered your mobile number and Aadhaar number, you are more a private person. Understand this? So don't live in the dilemma that you are a private person, मैं इसके साथ नहीं करता हूँ, मेरे बारे में कुछ पता नहीं है, ऐसा सोचना गलत है, अपने आप को दिखाएं। मैं ये कहूँगा, as a psychiatric nurse, I will only say, get yourself जामी, ऐसी कोई private life नहीं है। You are very available on internet. As long as your mobile number is registered, mobile number coming with Aadhaar card, everything is there on the system. So you are no more a private person. You are a public person now. Isn't that? Okay. Next please. Okay, so how nursing become a transformation? We know how that there is this lady like so much loyalty to this profession. How this lady started? You must have gone the history. And I believe everyone must be in the industry so that your group will become strong. अपने बारे में ancestors से पूछना, आपके दादाजी, नाना जी कौन थे, क्या करते थे, you will feel more presence. You will understand yourself in a more better way. If I ask about my father, who was my grandfather, who was my grandmother, they tell very proud. And I listen, I feel like it's a message for me to listen about it. Whose blood I am actually. So generation here. So you must read about Florence Nightingale, how hard she has done, what she has wanted. She was a researcher, she was a statistician of that era. You can understand. She has published this for that era. And today, if being a nurse, being this much kind of resources available, they are not able to publish or not able to contribute to the society, I don't think they are doing this with the profession. So and as I told you, now we are very difficult to publish paper, accept नहीं होता है, लिखना नहीं आता है. These are all excuses. I also started like you. I am not from different planet. I am from this planet only. And I am happy with myself. No regret. So this is not about how you can go, but it is about where you have to begin. Okay. So if you see, it's a progressive profession and everyone has business. हमने सब देखा. मैंने करीब 18 साल से 18 or 19 years I am in this profession as a tutor, an academic, and I have seen changes where things were, you believe or not, if I talk about mobile, I still remember I got Nokia mobile my 5 years when I was about to pass. Now you see everyone of us here having an Apple iPhone, even beyond that. I cannot say you know better. Don't you think it is a progression? Progression, admit it. You cannot deny it. So this is one example I am thinking. And in my college, I remember in first year, only one of my classmates having mobile phone. He belongs to very rich family. His father was like a district officer, some PSC, public servant, someone. He was having only at that time, incoming calls also having charge. If you have to take a call, you have to pay for it. I have seen that era. Some of the people, senior people, master team, more than the rest. कि वहाँ पहले बोलना इसका उठाना है, पिक करना है, तो चार्ज लगेगा. Incoming call was also charged. Now the phone is, I don't think so paying 300 rupees using unlimited internet, it's not chargeable. You should say it's free of cost. Okay. So there are many more milestones like simulation, telehealth, and AI, evidence-based practice, research, and many more. In couple of years, I have seen that a lot of nursing professionals, flourish. They really contribute very good research in different platforms, different high businesses. I'm very happy to see that and somewhere very like institutions. So find your icon who can inspire you. Okay, if you really want to go very long on the nursing, you have to put something into the heart. You have to put something. Simply sitting here that I become a faculty, I become a tutor, not doing anything, teaching, you won't have to for very long. You have to write something. Either write some research paper, either write something like students, write just at least something. But without contributing, it is difficult to do. Online hybrid programs, advanced education, interprofessional collaboration are few examples. There are very more examples of nursing professions, transformation, but only like contribute. Next. And we know change is inevitable. You cannot stop. It has to happen. We bound to happen. And so our profession is changing. And what we are observing today, after 5 or 10 years, not the same. Because what 5 or 10 years before, I cannot even say they don't compare that. I am a person from that era. So that is really difficult. World is fastly growing in different shapes, especially technology. Nurses make use of technology in different domains. You must be familiar. What our Suresh has told you, must be familiar with the terminology. That means the future of nurses. If you are a lifestyle nurse, if you are a health professional, you must have your reports from you believe. If I have my health report from birth, what example he gave and till today, I can precisely track my health report, how my health is improving or whether it is deteriorating. And accordingly I take action. हमारे यहाँ क्या होता है ना, चीजें अलग होती हैं. जब एक काम हार्ट अटैक आता है 10 लोग अगले से मॉर्निंग वॉक पे जाना शुरू कर देते हैं. That is not motivated. That motivation is not very long. 3-4 से 4 बढ़ गया है. मैं चल फिर किसी को इंसिडेंट होगा तो फिर वो ऐसे this is not basically motivation. You have to motivate yourself. मुझसे किसी एक इंटरव्यू पूछा गया जब मैं कोई इंटरव्यू कर रहा था. How motivated you are? How can I tell you? Do you have any measurements or something like that where I measure my motivation? When I am extremely motivated. You cannot know that it is very subjective. But you give me a task, if I don't know, I will say I don't know. But I beg you, I will go away, I will find it, explore it, and I will give it to you. So I am not even that kind of person. I am not like I know everything. No. I don't know anything. I need this here. And that is what gives me the motivation to learn. कि अभी ये नहीं आता है तो सोच लेते हैं. एक रिसर्च पेपर में कल मैं फ्लाइट था. So I was intended copy with myself. I deliberately got it from home itself. I will be 3 hours difficult for me to sit in flight. So let me read that paper. And it was just to read. मैं नहीं पढ़ पाया because it was less than around 10 pages. But whatever I read, I understood. So I need to say you can save your time by giving yourself, by committing yourself to the right things, and then definitely encourage you. Okay, next is. Okay, so there is a very simple question. That I last I read the future of nursing now. And if yes, what would the future of nursing be and how can we align ourselves with those changes? ऐसे डॉक्टर साहब ने नॉर्मली सीधी एक वर्ड बताया. कई लोग उसको गूगल करेंगे सलाई में कोई सही है क्या, देखिए तो सही में क्या है, हमने तो बोल दिया तो एक्सपर्ट हैं, उनको पता है उसका खाना वो उसी में काम कर रहे हैं. आप आएगी उससे कुछ नहीं चाहता कहीं खाना यहीं पे ऐप से डाउनलोड किया होगा, देखेंगे बनाएंगे ना आएगी ये बहुत इजी है. सिर्फ आधार कार्ड वही मटेरियल आगे पड़ती है OTP आएगा your Aadhaar ID will be generated. बहुत easy. So this is how the sensitization is. At least I must know. Many people do not know or they are ignorant about the fact that this kind of things are available. But we must make ourselves familiar with the changes whatever is happening in today's generation. आज मेरी 10 साल की बच्ची मैं जो चीजें ऑपरेट नहीं कर पाता हूँ मोबाइल में टैबलेट में वो मुझे मतलब बता देती है पापा ये ऐसा होता है मैं इतना नहीं बहुत सकता हूँ ठीक है आई एप्रिशिएट यू बट यू हैव बेटर नॉलेज देन मी मींस सी डाउन व्हाट आई डोंट नो इवन and in that case I want to make a review because I don't know such a remote areas where we are no newspaper no roads thing was available at that time. So you can understand how the social media has been changed, how we are grown or what level we have grown. And we are growing. We are becoming like superpower. Okay, next please. Okay, so there is a concept of virtual justice. It's not a new word basically. Virtual means you are not available physically, but you are doing things remotely. By using any of the telecommunication technique, in nutshell you must understand. Like this session is feeded online or live. Many nurses might be hearing, maybe. So I am like virtual system about it. Same concept having the research also same concept websites that the nurses are available, but since that this patient was attended by particular nurse is available, she will be available immediately online. She will tell the progress of the patient. She will contribute in the recovery and treatment charge available of the patient. So that is about nursing. Daily health nurse, virtual nurse can provide remote area by telephone or by video technology. Since I am coming in the area where we have different Uttarakhand, there are Kedarnath, Badrinath, Joshimath. You believe or not, patient take 5 hours to complete 100 kilometers of journey. Sometimes more. Even sometimes he has to come one day before. Next day he will be in the line of doctors. Once he will get examined, he will have assistant or whatever treatments he has to go away. Means at least 3 days he has prescription coming. Why they say just prescription? If a doctor available, he can examine you then he has come in the video, telling your history. That's what I am doing in offline also. Offline में कुछ और तो नहीं करना है ना, आपके पास prescription आता है, आप आपकी prescription लेते हैं. BP बोल दिया. Now we have wearables, these devices, wearable sensor devices. Most smart watches or most smart spectacle or these are the most wearable devices so far. And they are so precise, giving about your data, about your blood pressures, about your ECG, about your heart rates, about your sleep durations, about all other things. Even they give alarm. If you fall suddenly, they give alarms. Okay, so you have to notice, but they are designed in such a manner, such a software are getting very sensitive body. Yesterday you were very friendly discussion that now the cars are having AI built technology. If suddenly something comes, they will put brake automatically. In most of the cars nowadays. Even in 30 minutes, that car AI system will sense your body and it will understand and make artificial image. After that, you will sleep. The car will alarm. Are you sleeping? Please wake up. Or if you won't wake up, then you will car in the side. And they will park. In US, this technology is running since 10 years back. I still remember, I think, in 2021, in 3-4 years back, I was visiting there. That time I have seen one car, means one of our long medical conditions. officials. His in-laws cargoes. वो आगे से पूरा ऐसे कार बोल करके हमें चाहिए नहीं करना पड़ेगा। वो सर इंजन की इलेक्ट्रिक कार है। सर वो इलेक्ट्रिक कार ठीक है, इलेक्ट्रिक कार का बनाना है। Then you are starting telling, sir, this car we have only read the registration. I will say this car is taking the registration will stop. ठीक how लेवल इंडिया में थोड़ा मुश्किल है। कोई गाँव के सामने गाय भैंस बकरी कुत्ता कुछ भी रखता है। You get my point, right? It will happen one day. I believe in that. There are probability, high probability. It can be. Okay, next. So telephone of communication technology, why communication technology, device using telephone can replace face-to-face with video conferencing and sometimes being situation you don't need physically the processes. I'm not going to my level, keep on pointing, keep on fluctuating my speech, not only is not bad, your efficiency is will place it right. And you can get more back. Next. So we talk about the no solutions. So basically, you know how first challenge who has used first challenge is phone, who has invented of the phone, Graham Bell. He was chilling sick one day and he made a phone call to his assistant who was next to him. This was our first call, first example of television. It's like I am engaged, my assistant is there, he was not doing very well, he just called me, Wilson, I think his name is Wilson, I remember, I was very one day. So Wilson said, could you come, I want to see you. That was first official recorded call in television campus. Nowadays, everything comes up on WhatsApp का report now. आप देखिएगा वो कॉमन WhatsApp पे हमारा सब कुछ मैं देखता हूँ बहुत सारे साल में लोग सब देख रहे होंगे तो मतलब MRI की रिपोर्ट रिलेटेड है WhatsApp पे सब देख लीजिएगा हालांकि ये can be used but you need to use through the software because WhatsApp whatever image you are getting it is not that much quality image you may make errors right MRI नहीं एक एक्सपर्ट उसको 10 बार ऐसे फड़फड़ा के तो देखेगा कि उसको पता चलेगा अच्छा ये चल रहा है तो मोबाइल पर चांसेस ऑफ एरर का है it's help out कि मेरे पास बहुत सारा नोट्स आता है मतलब करके फैमिली मेंबर में ये देते हैं आप यहाँ ये बता क्या है नहीं तो दिस इज रियली गोइंग टू हेल्प और कटिंग आउट those improving your decision making all of that so then we have seen these four five solutions now technology revolution says yes we have technology with ourselves any other things Alexa Mini artificial intelligence Apple voice you give a command them they will do their jobs Alexa can play something for so much okay I am reading you don't need to go and text you can remember the cassette recording takes time don't forget your roots issue is that remember your history if you know history you are the powerful person you know from how long journey I have covered under what struggle I have come to that at least when you are a person you can tell your stories to your son and daughter you have something to share with your son and daughters at least इतना बात आपको होना चाहिए मैं जानता हूँ कि नहीं कर रहा हूँ आवाज लेकिन आप अगर मेरे नहीं समझते हैं definitely you must have something with yourself that you can share with your child that must encourage them inspire that is the only expression I give you from so what about you I work for you at least my son will be of 20 or 25 age I must have something I grow up like that and I am providing you all the resources but make sure you must understand the value of money how it is learned, how it has been utilized. Teaching them very well and more important. I understand that there are different fathers, different kind of mothers. But in psychology there is one concept. Teach your child how to wait. Teaching how to wait will develop patience in them. If your child asks me, I sleep. And if you why immediately, you do not allow him to think even what is the waiting time, what is the meaning of wait, what are the patience. When he will grow to that age, he could not achieve. He will have no choice but to commit suicide. That's what the reason of collective suicide here. उनको कभी आपने प्रेशर से सिखाया नहीं, you never taught them कि भैया failure भी success की तरह ही होते. Even if you fail more, you will learn more. Success hardly teach something. Failure only teach more and more things in terms of patience, in terms of hard work, in terms of perseverance, in terms of many other things. Okay. So we have high standards. एक टाइम मतलब हम याद है जब मोबाइल में 2G 1G तो क्या चलता था मतलब पेज नहीं खुलता and now 5G is coming 6G is already tested this is going to launch now I can directly see any of the video any movie on YouTube without copyright very non it was not there earlier अभी जो हम टीवी देख रहे हैं मतलब मैक्सिमम इंटरनेट के थ्रू देख रहे हैं जियो फाइबर and all sorts it doesn't know buffer whenever they will show you will start showing you the movie and all you don't need to download now the concept of download is almost automatic you hardly need downloaded movie in later to watch how many you do that so far I stopped from videos. Now you have available. Just go to the YouTube, it will start working. So technology is done. Wearable devices, everything, whatever you want to have. There are some certain which are very necessary. Then mobile real-time communication devices are they are synchronized. Your mobile, your watch, all other devices. Even if you are any other wearable device, both some of kids in my campus have seen. They have been diagnosed with type 1 diabetes. Any year old child. There is no age of any sort of right now, will remind you. Now, heart disease is not a disease of 40 years plus people. It can kill a person, it had killed a person after 1 year also. So, he has experienced the bad all the times. Where glucose monitoring continuously. I have one with me. She always used to use the BP monitoring device, and it will give recording after hours. So this is a real time. After mobile के साथ sync होकर रहने वाले साथ, then mobile data is captured in your mobile. You can see every day at the end of the day how my BP has fluctuated, how the blood sugar has fluctuated, how my health is fluctuated. So that is a big revolution. Next. So it's like a game changer. It has long-term implications and every aspect. It's not about the inpatient इसका क्या है, outpatient नहीं है. Every whether it is eliminating care, whether it is hospice care, whether it is inpatient care, outpatient care, critical care, every area has advantage. And must start doing things like teleconsultation. They are just some name to remember, but it's all about taking. They go just because they are doing consultation. You just teleconsultation. They are doing teleconsultation. That's what they recommend. Psychiatry. So like they So basically a big break for the whole population. The hospital, especially like right now my hospitals, where every day helicopter is taking flight. Every day helicopter is going the 100 kilometers when they see some dogs, even I be part of that command team. In India, we have only single heli ambulance service with us. in India so far. It was inaugurated by Modi ji recently. Nada ji came in. It was very well established. We have one dedicated helicopter with us. All fly like other because whenever we receive a call from trauma centers, the helicopter will take a flight. They will go take the patient, bring the patient. Yesterday itself one of the had some heart related issues. The helicopter went to them. They brought it. They were ready. The stenting all is done. Transmission is done now. So it's an system. We have road services. They are delivering the drugs. They are getting samples from remote areas. So we feel privileged to have such services in our setup. And luckily, I have been part of trauma center since the beginning. That's why I visited a couple of countries to observe their trauma center, trauma systems, so that we can establish the same trauma system in our setup. And we try our best. Except two things like they have lack of populations, lack of patient research, which are very trauma center में बहुत 10 लोग आ रहे हैं. मैंने खुद ने देखा. Only 10 people are visiting trauma centers in a day. Here we do not have countable numbers. Sometimes 200, sometimes 250. Disaster होगा 1000, 5000. So we have obstacles, but not going to operate about those obstacles. We have tried our best. At least we have trauma level 1 center. Next. So if you see that Delhi has increased to 766% in the first week of pandemic, what Dr. Suresh has told. When it was declared pandemic in March 2020, in 3 weeks you can understand these many people started using the phone लगाने मेरे को तो हो रहा है, कोविड हो सकता है क्या चलाऊं क्या? आपने भी क्लियर किए होंगे. Don't forget COVID. Okay. Current health infrastructure is not as per rising demand population. There is many challenges. Technically, the best solution for it. We understand that all everyone to the hospital. We do not have specific infrastructures. Then this I already talked that health having scope in every area. Whatever area you talk about, there is pediatrics, there is neurology, there is midwifery, psychiatry, hospice, very chronic, follow, respite, whatever the area you talk, it has demand. It is not like the health service is available in psychiatry. So in each and every area, it has scope. Next. So it has diverse applications. I think some of them already been talked. Remotely assess diagnostic patients, real-time information आपको मिलेगी, decrease burden on physical structures, improve structural patient outcome. Patient को 4 दिन लग रहा था हॉस्पिटल आने में. अभी 15 मिनट में उसका काम हो गया, वहीं डॉक्टर ने दे दिया उसको ऑनलाइन. ठीक है, कोई प्रॉब्लम नहीं है, थोड़ा सा तकलीफ का इशू है, मैं दवाई लेके आपको भेज रहा हूँ, आप दवाई ले और मुझे 2 दिन बाद आपसे कॉल कर रहा है. You can understand. वो अकेला ब्रेन है तेरे उसका 3 दिन का जॉब किया है. अगर वो आज कमाने नहीं गया तो शाम को उसके बच्चे ठीक से खाना नहीं खा पाएंगे. It is so breadwinner. So that concept you have to understand that one of my PG students doing this study. Satisfaction and challenges faced by young users in education. So we are trying our best, but somewhere they are like I understand there are more challenges. But we have to start somewhere. कहीं से आपको शुरुआत करनी पड़ेगी और अगर आपने शुरुआत की तो डेफिनेटली it will go to very long way. This. So same like M has basically when you use particular mobile device, it's a we can say advanced or a sub way of delivery where only mobile device will be used for the communication or external or others. So that is how the only difference. No specialized uniform definition of M is available. The more or less supported by mobile devices. Okay, like liver health information, education equals means any area using any mobile health in any context to educate the population, to teach the populations, to deliver your interventions. Like आप maximum जितनी भी lab laboratory सबसे आपके अपने हैं. जब भी आप एक सैंपल करेंगे सपोज घर में कोई काम है सैंपल आप करेंगे go to the web app like कोई भी ऐप ले लीजिए, go to the app, raise a request for samples, within an hour or the person will come with the sample, the report will be automatically in the lab section. You don't need to go and like personal physically in the lab or you don't need to go, 10 kilometers to lab, वहाँ पे situated है, वहाँ जाना, no, you don't need to come. Our person will collect the report will go automatically into the app section, you just open the app and see your report. So in any aspect, whether it is monitoring health, whether it is economic behaviors, like there are a lot of app open with system. You can search on Google. If you are research, there is an app which can help you to do smoking. There are a lot of apps which help you to do yoga, to exercise every day, different kind of stretching every day. Like this में जाओ, स्कूटर में जाओ, बहुत सारा काम करना है. Whichever app you do seriously, हमारी डायरेक्ट एक्सेस but at present there are more than 35,000 applications related to health. 35,000 applications. Okay, next. Okay, so these are the basic differences. You can go. I'm not going to teach the differences necessarily. What are the differences between tele and mobile? If you see the example, you can understand. Medication in my mind should go to the monitoring. So almost it is using technology. Basically, it app based, more or less. And app, definitely you have mobile phone, there only work. Without mobile phone, it is difficult to work. Okay, so that is what basic difference. Next. Now, I think these are some things you are every day noticing. It's not. Now there is it become very regular practice to the mobile operators. Airtel, Vodafone, that you have to report and reflect every spam call on the user device. जब भी आपका फोन बजा था तो स्पैम कॉल निकालता था. ये पहले नहीं था. अभी ये एप्पल में नहीं आता. सिंस एप्पल से मोर सिक्योर कंपार्टमेंट है. बट अभी एप्पल में कोई रिपोर्ट होता है. एयरटेल में कल परसों इसका मैसेज था. नाउ एवरी फोन कॉल whether international or domestic, if it is the same or it will be reported. Okay, so we are using technology in every sense. Mobile also is many calls making us more or less हम अभी नहीं चाहते हैं कि हमारा कॉल नहीं आता है. Someone calling is not share. This is all about using technology. Unfortunately, मेरे बच्चे ये नहीं जान पाएंगे कि बुक लेके पैसे कैसे विड्रॉ करते हैं. That's the problem. कुछ चीजें वो बोलिए एग्जांपल मिल जाएंगी और उन्होंने हमें जो रिकॉर्डेड कैसेट होती है सीडी प्लेयर होता है उसके बारे में नहीं पता हमको. देखो so anyway somebody could be if there is a हमने चीजें नहीं देखी तो let it be. Okay. Next is okay. These are some areas actually I am not going to read them, but it indicates that applications are being used for purpose by practitioners, by doctors, by nurses for one another purpose. Next is so it has multiple benefits. I think we discussed this. It has remote monitoring, ease of accessibility, affordability, improved satisfaction, improve outcomes, adherence. If you have a mobile, remind apps, it will help. When you have to go for the follow-up, when you have to take your medicines, what time you have to take medicines, which medicines you have to take. It has a standard research charges. Good research. Use your mobile, even I have some research mobile applications where it clearly comes out using mobile as a reminder. So we have done the research. If you use mobile as a reminder to just call them and follow up, it will have a huge quitting rate in those groups. अगर मोबाइल पर रिमाइंडर जाता है today is your follow up and age situation. आज भी कल आया है. और वो मोबाइल पे रिमाइंडर मल्टीपल टाइम आता है. ये है इसलिए ये बार-बार यही आता है. वो साइकोलॉजिकल है. आपको कन्विंस करना ही नहीं कि आप ये प्रोडक्ट खरीदें. कभी ऐसा है कि नहीं बना रहा है तो मत कर ये डिसअपियर हो गया. वो मल्टीपल टाइम से होता है तो साइकोलॉजिकली बाउंड है. जो भी चीज मल्टीपल टाइम आपने आपको समझ में नहीं ना आप That's what they are saying. So they have tell them, yes, I have go quota, I have pol. And if you really attend the follow-up, then definitely the fill rate will be improved drastically. Okay, next. Yeah, despite there are many benefits, but there are some disadvantages. In minutes, I will discuss with you. Privacy already discussed. Confidentiality, informed consent, data security, which is data is there. In country like I will tell you one example I remember. When I was doing postdoc, I need to go for one social security card. Since it was COVID, so they people only accepting the mobile phone. कि आपको पहले मोबाइल अपॉइंटमेंट लेना है तो मैंने कैसे करके मोबाइल अपॉइंटमेंट लिया कि बोल रहे हैं मैं बात अपॉइंटमेंट नहीं पहले जानने के लिए उसके बाद क्या हो सोशल सिक्योरिटी नंबर anyway they are consider my request related policy I went the lady was there is already showing me the documents I know all the documents unfortunately एक document में नहीं कि आपका यहाँ से मेरे नाम मिला है यूनिवर्सिटी से वो पता है कि मुझे चाहिए can you see this is from no I want not I see you this was president now हमारे सर देखो ना ये WhatsApp पे जैसे मेरा आईडी कार्ड डाल दिया जो भी आप अपना चाहते हैं मेरे सारी पेंशन कार्ड जा रहा है the line I still remember the line and this was clearly indicated that they are not supposed to push my loyal because they respect privacy. उन्होंने ये आप नेक्स्ट डे आए अपना डॉक्यूमेंट कार्ड में देंगे हैं जैसे ही आपको डॉक्यूमेंट देंगे हमारे देश में तो चल अच्छा ठीक है तो लैपटॉप में दिखा This is the meaning of data privacy. इसलिए मैं बोल रहा हूँ जो भी लोग मोबाइल पर पहना है प्राइवेट नहीं है समझना वाला समझ सकता है आप समझ करेंगे आपने प्राइवेट नहीं होते ठीक है so टेक्निकली लाइक सिस्टम फैमिली में है साहब ने बताया है कि स्नोमैन सिटी ऑपरेट करना मुश्किल है हमें फैमिली होना पड़ेगा उसके लिए स्टाफ को ट्रेन करना पड़ेगा हमारा लोग ये चाचा को यूज करने के लिए फैमिली नहीं है क्योंकि हमारे पास नर्सिंग इन्फॉर्मेटिक की कोई ऐसी पोस्ट नहीं है नहीं है या नर्सिंग इन्फॉर्मेटिक की कोई ऐसी पोस्ट नहीं है हम प्राइवेट या कॉर्पोरेट हॉस्पिटल में फ्री होते देते हैं या आपको नर्सिंग इन्फॉर्मेटिक्स इतना नर्स का अपॉइंटमेंट है लेकिन गवर्नमेंट में ऐसा पोस्ट नहीं है हम अपनी मर्जी से कीजिए आपको हम थोड़ा नर्सिंग इन्फॉर्मेटिक्स में ट्रेन कर देते हैं आप अपनी काम कीजिए तो मुश्किल है इस बंदे ने कोर्स को किया ही नहीं है आप नर्सिंग कराने के बाद आपको नर्स इन्फॉर्मेटिक्स कैसे ट्रेन कर सकते हो या तो कोई डिप्लोमा हो 7 साल का या नर्सिंग इन्फॉर्मेटिक्स डिप्लोमा करना है उसके बाद आपको डेडिकेटेड जॉब मिलेगी सो दिस इज द अनदर चैलेंज बेसिकली वी आर नॉट मच फैमिलियर पोस्ट इज अनदर इशू ऑपरेशन लिंकिंग कम्युनिकेशन चैलेंजेस नीड लोकल एंड नेशनल रिसोर्स अगर हमें कोई चीज भारत में जाएगी बहुत विविधता वाला देश हर चीज में अलग लैंग्वेज बोली जाती है मुझे यहाँ पे आके प्रोफेशनल जैसे काम करना है मुझे मराठी सीखनी पड़ेगी उसके बिना मैं काम करता हूँ सेम थिंग आपको अगर मेरे स्टेट में आके काम करना है तो आप इस लैंग्वेज में काम नहीं कर पाएंगे क्योंकि लैंग्वेज वेरिएशन है सो ये इश्यू भी है and I am pretty sure that this people must be working that this has to be translated into different languages also. Yes. I was ready for that. Because of that, you know what? मैं उत्तराखंड में काम करता हूँ, रहने वाला मैं राजस्थान का करता हूँ। उत्तराखंड का नेशनल लैंग्वेज लैंग्वेज और कोई नेशनल मतलब सॉरी स्टेट लेवल लैंग्वेज यूज करेगा समझ में नहीं आता बिकॉज़ आई एम नॉट फैमिलियर हिंदी में मैं बात कर सकता हूँ आई कैन टॉक इन हिंदी नो प्रॉब्लम बट टू वर्क इन दैट एरिया फ्लुएंटली आई हैव टू लर्न द लैंग्वेज ऑफ दैट एरिया सो दैट देयर नॉलेज makes sense. Okay, so last topic just only 5 minutes AI in nursing basically अलग-अलग ये तरह ऐसा इस बारे में है बहुत कुछ बात भी आ रहा है सारे चैलेंज की पूरी तरह अभी हमारे कंट्री में भी जो हम कंसिस्टेंट फेस कर रहे हैं हमारे पास ऐसा फास्ट डेटा अवेलेबल नहीं है we do not have archive data without having archive data AI is more useful मैंने हमारे हॉस्पिटल में एक स्टडी किया रिट्रोस्पेक्टिव रिपोर्ट एनालिसिस फॉर स्ट्रोक पेशेंट्स फॉर सम लॉन्ग लाइफ फॉर ये मैंने देखा कि हर केस के ऊपर कोई कंसिस्टेंसी नहीं है, ना प्रिस्क्रिप्शन, ना इन्वेस्टिगेशन की, ना ट्रीटमेंट, ना असेसमेंट। कोई आगे जीसीएस इस तरह से लिखा है, कोई आगे जीसीएस इस तरह से लिखा है। अब उसको कैसे करें? कुछ में लिखा ही नहीं है, कुछ में कंप्लीट लिखा हुआ है। तो जब तक ये यूनिफॉर्मिटी नहीं होगी, आपको यूनिफॉर्म तरीके से डेटा मिलेगा, तब तक ये हम नहीं कर पाएंगे। क्योंकि डिसीजन मेकिंग आपके ट्रैक रिकॉर्ड देगा। If you see your whole report from 0 till now, and then you will predict the analysis कि आपकी हेल्थ के साथ क्या होने वाला है, and what will be the impact. So it's not one shot business. आज आपके डेटा निकाला गया है, ये उसका नाम किया. It's a wrong decision. अगर आपको मिल भी गया है, ये decision wrong है, तो उसको delete कीजिएगा. You need whole lot of archive data, your whole life data at that time you work. Okay, so could be again be years progressive approach concerning most effective high quality care definitely. They are running robotics and all those things are happening. We are using robotics also, robotics using surgery and all those things. Just fit the data of the patients. What are the information? Robot automatically doing surgery setting in the next room. Robot is doing the surgery. We have robot doctors also. So we are doing that. Okay, next. तो हमारी योजना ये है कितने लोग यूज कर रहे हैं? फोन में तो भरते होंगे, गूगल में जेमिनी, एप्पल इंटेलिजेंस, है ना? उनको कमाना तो एक चीज यूज करते ही होंगे। ऐसा मेरे को भी ऐसे टेक से लिख के आगे आ रहे हैं और मैं क्लियरली कंटेंट देते ही बता रहा हूँ ये चैट का कंटेंट है बच्चे, आप ये तो मुझे ये पसंद नहीं है, आज नहीं बताऊं, बट ये प्रैक्टिस मत कीजिए, ये तो इससे कुछ सुधार नहीं होगा। तो बहुत पोलाइट लोगों को बोलते हैं देखिए ये मत करिए, आई डिस्करेज। आप चैट को यूज करो, लेकिन कंटेंट पढ़ने के लिए यूज करो, कंटेंट को आप अंडरस्टैंड करो और लिखो। चैट जीपीटी की जगह आर्टिफिशियल इंटेलिजेंस जो है वो आपको शाम से डेटा देगा, आपको एज ए मतलब कॉम्प्लीमेंट और सप्लीमेंट हो, उससे आप रिप्लेस मत करो ह्यूमन इंटेलिजेंस। और as a PG student, some more responsibility that they have to deal with the books. You have to deep down the books, research further, you have to find the right content, you have to. I still remember my days, we have to just say I पहले मैं उसके notes लिखता था. पहले लेकिन my books, relevant books, and all those things. Then मैं उसको type कर रहा था. Then the seminar used to present. अभी स्टूडेंट है वाला ये कमांड क्या क्या आपके लिए अपना डाल दिया गया वर्ड पे भी वर्ड अपडेट लेके ऊपर कर दिया सारी तरह से थोड़ी हमको पता है चैट जी कैसे कनेक्ट करते हैं चैट जी के लिए और इस बता रहा कहां से चैट जी से ऑनेस्ट इस्तेमाल का क्लास में मुझे सोचिए क्योंकि ये मतलब तो इसमें कुछ चला नहीं ठीक है। तो इससे सब कुछ बेसिकली आई अप्रिशिएट बट यू ऑब्वियसली यू एज ए कॉम्प्लीमेंट कर सकते हैं जहां आपका लगता है कि देयर रिसर्च on this topic in India. Ask the technical. You will use some resources. उन रिसर्च से आपके को डाउनलोड करके अगर आपको आपने इसमें गूगल सर्च किया आपको नहीं मिला आप चैट से you will analyze all the resources, all the websites, you will give the right example. Yes, there are some similar or like research available, not on this topic, but they are good similar. You can go these topics, these websites, and you can find out. So वो help करेगा, okay? But what replaces it? And next is diagnosis of wrong methods. Any use, any field, any type of work आप use कर सकते हैं. There are a lot of formulas, algorithms, clinical decision making, EHS, medication administration, predictive analysis. ये सब ये टाटा का एरिया में हालांकि day before yesterday Bill Gates का स्टेटमेंट है by 2035 ये रिप्लेस डॉक्टर्स एंड नर्सेस। हालांकि जो कन्वेंशन नहीं लगा वो स्टेटमेंट क्योंकि 232 हो सकता है दूसरी कंट्रीज के लिए मैं पूरा डिटेल तो नहीं पढ़ पाया लाइक कंट्री लाइक सिंगापुर कंट्री लाइक यूएस इज लिटरली पॉसिबल बिकॉज़ ऑल डेटा इज इलेक्ट्रॉनिक and the access of डेटा अगर सिंगल का एक क्लिनिशियन यहाँ बैठा हुआ है वो पेशेंट को लॉगिन आईडी आके देखो पेशेंट का डेटा उसके सामने होगा कि मेरे पेशेंट को अभी इस टाइम क्या चल रहा है। बट इंडिया में एक्सीडेंट नहीं रिसेप्टिव हॉस्पिटल आई कैन अंडरस्टैंड और है बहुत शॉर्ट टर्म डेटा है कि ये 2 साल 3 साल से 4 ये सब रिकॉर्डिंग और सुनना हुआ है तो वी डोंट हैव द इम्पोर्टेंट without the difficulty process. Next. This is one thing I basically what we have one example. If you have to take informed consent or to take decision making, you have to provide information. अगर ये पेशेंट सपोज क्रिटिकल एरिया में पिछले हफ्ते 10 दिन से एडमिट है उसका सारा डेटा आपके कंप्यूटर मॉनिटर पे नहीं आ रहा है, ठीक है। इंफॉर्मेशन कॉम्प्लिकेटेड नाउ यूजिंग एआई do we need to change the treatment protocol for these patients. Make sure that data must be complete enough. If the data is not complete enough, AI give you a wrong decision. AI बहुत सारा wrong decision लेंगे। Essentially AI 100% से बता रहा हूँ इसलिए ह्यूमन इंटेलिजेंस को वो नहीं करना है। Ultimately उस decision making को कंसल्टेंट को एक्सपेक्टेड कंसल्टेंट ने डिस्कस and they will find yes somewhere we align our opinion also we have for this kind of changes. So that we have one understand and that's how this is taken. It's a decision algorithm. What we used to say in the more technical words, if you have the data patients, similar kind of patients you want to do. Now, if you see, I read some of the Western researchers. They are doing a retrospective what last 20 years of patients having hypertension. Means उनसे patients data past 20 years. Now we understand 20 years data past already available by next time. उनको सोचे एक लाइन है परमिशन आती है तो they will provide the data. But unfortunately we don't have that. So that data collection will take time and after it will be easier to work to make the decision making and developing decisions algorithms and all. Okay, next is. Yes, I think you already discussed the similar challenges. We are not ready enough. How many years? We have got resources and experts are not available. Lot of other challenges like language barriers are there. Many more challenges are there. Yeah. So despite a lot many benefits of AI, it's not from limitations. Disadvantages and limitations are different. Okay, because it's a lack of human interactions. That's what I was talking. That you don't need to depend entirely on AI. Understood. Then ethical considerations will be there. Sometimes like things related to privacy, things related to consent, many other ethical things. Then post-technical requirements, it's exactly post. Why I want it's cost affairs for a common man. It's not easy. Potential for errors, data theft, cyber security, new technical support. If you have some troubleshooting, who will do it? अगर गलती से हो गया, application से हो नहीं, who will help you in that matters? या सिस्टम में कुछ errors दिखाना, who will help you? That is a different thing. So there are challenges, there are some limitations. Next. Okay. So from the end, basically, it is definitely true that we are having undeniable of technology in healthcare. We cannot say that technology is not helping. Technology is bringing more solutions and lot of things, transforming things in the couple of years and maybe in the next couple of years will be moving. So technology will change the scenario of nursing care, but the need of nursing will remain. आपकी जमीन बढ़ेगी, ठीक है? ये cannot be replaced. Whatever type of level of care comes, nurses should be smart and tech-friendly for you and them. Basically आप अगर अपने develop करना है, नहीं वही मुझे ये app operator करना चाहिए तो आप अपने दूसरा ले लेगा. So get yourself acquainted with the technology जो भी आगे आ रही है. जिस एरिया में आप कर रहे हो वहाँ की इक्विपमेंट यूज हो रहे हैं, स्टाफ से फ्रेंडली हो रहे हैं. भाई हम यहाँ पे एक नया आया है. इस वेंटिलेटर को मुझे कैसे ऑपरेट करना है, हाउ टू गिव कमांड, हाउ टू चेंज डिफरेंट मोड्स, आपको फैमिलियर होना चाहिए. किसी कोई आपसे अच्छा फील हो एमरजेंसी से सही कैसे होगा, ऐसे होगा. और knowledge को जो चमड़ा नहीं होता है. If you have knowledge, you can read anything. But you must have right knowledge. AI implement nurses not as such as human touch and impact remain irreplaceable. तो जो core component है हमारे नर्सिंग के human touch, empathy, sympathy, they will always be there, and as long as they are there, so use AI, but use it judiciously. With these words, I conclude my session. If any doubts, you can ask me. Please go straight. Thank you very much. So be smart. We collaborate with the nursing partners. Other collaborators that can make yourself more comfortable in the current environment. Thank you.
Thank you, sir, for providing lecture, introducing and teaching informative knowledge. I request Dr. Surya Karan to appreciation to Dr. Raj Kumar sir.
There is a short assistive comprehension publication.
एक्सपीरियंस को देना चाहते हैं जिसमें कि
He is awarded in Distinguished Literature in year 2014 by HM University. Sir has received Rashtriya Gaurav Award 2017 by New Adarsh Shramjeevi Patrakar. He also got Outstanding Mentoring Award by Kosham Foundation, India in year 2020. Sir is appointed member of International Chair in Bioethics Haifa and awarded by KHARGAHR India for invaluable service to the community and contributing to the nursing research in 2024. Sir published over 40 research papers in national and international journals, indexing scopus, WS, POL, and UGCA. He has published 5 MNHP documents for BSc and MBBS nursing, clinical and practical record for BS nursing, community health nursing secretary for GNM, introduction to the forensic nursing, and Indian law applied nutrition and dietetics for the BS nursing. Over to you.
Good afternoon, everyone. Thanks to Dr. Chipala Foundation and Association for inviting the national conference. My topic is seamless education in the digital era. From morning, our speakers speak about digital platforms and everything, but how the digital education can be used during the training that was business learning. So what is the simulation or session environment to train the students before going in the clinical areas? Because we are dealing with human beings, and in the hospitals we cannot do the error on the patients. Before COVID, we are utilizing our traditional way, first theory and traditional ways for the diagnosis and we are assessing the functionality in the clinical areas of the patient treatments. Whether they are negligence, but they are really errors of the cases. If you see in our countries, the nursing and the medical trainees, doctors or nurses cannot allow to treat the patients during their diseases. They will learn in the stress area, in the stress environment. So same when COVID came, is one another thing hospitals, postings are provided by the hospitals and nurses. So where they will be maintained. So more again nurses councils and the purpose is to bring the simulation in nursing. And in 2021, the syllabus also is the thesis. They bring in that assessment also, and there are many studies that shows at least 25 to 50% of the syllabus can be changed in the simulation-based learning from the traditional learners. So in that, the simulation now is again the suggestion how to teach the simulations. Many of the things we need simulations days, that is too mostly for the institutions how to manage how the cost come from where, and the training simulation trainer and the teachers. So bringing that gap, the SSC University, Indian Nursing Council, Japan, and USA come together and establish the national center in India, that the SSC University in 2018, and start something after 2021, after COVID. And until now, we have trained more than 1,500 teachers from all over India for the specialist training. I think President and another faculty also trained and specialist. They have their two types of training, but one is the DOT and one is the midwifery training for 5 days, and DOT for trainer teachers for the 6 days. And basically we are teaching how to run the business scenario in your own language. It is not required big setups and infrastructure, but we can run small setups also with some tasks like small many low fidelity manipulations and tasks. So that is going on, and today we will see how students will function. Next slide. So nursing is a focus for the preparation of competent, compensated nurses, skilled nursing professionals capable to meet the diverse needs of the individual, family, or the community as a whole. And additionally include the theoretical knowledge, clinical practice, hands-on trainings to develop the critical thinking, decision making, and technical skills. What we learn in our areas and now in recent years, has involved a significant with the integration of the modern technology in a very teaching strategies. There are many pedagogies also used for the nursing professions, and in that the nursing is one. What we are doing is the same thing now also. We have come out first theory, then when we go for the website, our student will go for the practical for the specialists before going the simulations. Then they will go to the lessons day, and in that day they will be trained for how critical thinking and decision making happens. And then they will be sent to the hospitals. So wherever will be the address when they will practice in the hospitals. The critical thing and decision making abilities is to be by these simulations scenarios. Next slide. So currently advancement in the nursing education, the modern education, specific-based learning, we will go for 4 years. E-learning online platforms after COVID, everyone are using for that. VR and AR, virtual and augmented reality simulations, artificial intelligence, AI service on that. Then they have trainings, how it is going on. Then competency-based education, interprofessional education, and interprofessional education. This is also far more business because when we are working in the hospital sector, we work as a team. As all nursing doctors, paramedics, and other supporting staff. So when we are training in the nursing college, only there are the nursing student and doctor, but as soon as they will be really serious, one will play the role of the doctor, another will be the nursing officers, and one staff nurse, and another one will be the paramedical as per the requirement. And these are the nursing students only, with the supervision of the teaching faculty and businesses. So by that they can go for the critical things. Everyone do their job, and then they directing success and they take their decisions. Next slide. So how busy era enhance simulation based high fidelity manipulations. These are the real life models in the simulation. They act like human being. They can check the pulse and they can speak. So the real life has to provide to the students to learn. These are the high fidelity manipulations, and we can do the CPR, I insertions, and even the level deliveries. We can train because the nursing student have to get the chance of the delivery in the labor rooms. They are not allowed to do the trainings only. So now most of the cases are not going for the cesarean. How they will be trained. So these high fidelity managements can train all the type of the labor cases, breast delivery or any other, they can train as per their requirements. Then virtual reality and AR, 3D now is also there. 3D environment halls, students can study and engage in live clinical sessions. Can be like the 3D movies you are seeing, same in a 3D environment, is created where the hospitals like settings we are usually see and how can be affected. So all the things that drivers and immediately which was there and they can be trained for there before going on the roads. So same the 3D will for nursing spaces. Computer software are available easily that can be used in any computers and can be trained for the nursing students. Technical has simulations we have already discussed. So artificial intelligence also discussed in models. Simulation-based education transforms learning in the healthcare, use the realistic scenarios in the environment of living. Clinical specialists allow us students and professionals to practice procedure, decision making, and the patient interactions in safe, controlled settings before transfer in the real world. So once they will enter in the hospital settings, all the procedures can be done in the specialist areas, and their critical thinking will be enhanced by taking their decisions and debrief sessions. Next. So artificial intelligence sufficient and minimum risk can be by these solutions. Artificial and the scenarios can be prepared and the representation to give the experience of learning to the students. So when they come to the business areas, they will be given for a scenario that the trainer will be there. What is the case? It is a roadside case came to the hospital. Now what you will do? This is the situation and you have yes, KHARGAHR. Now you have to handle that team of the students, one doctor, one nurse, they will play their roles, and the teachers will see them. They will not talk in between what they are doing. They are doing good or they are bad, whatever decisions they are taking, they will observe. And we have a special report. We have 360 camera installed with audio, visual, everything, so that all the what decisions they are doing, what procedures they are performing, and they record it. And they go the brief sessions. That is the more important. After that, how deep sessions will be. That is main experience can come delivery. Then they will ask why you have taken these decisions. The students will whatever they learn in the theory and practical knowledge, based on that they will reply why I have taken these decisions. And based then the teacher says the trainer sees you can take this decision also. Where you have done wrong, they can show their teachers also कि आपने ये गलत किया, ये डिसीजन सही नहीं किया था, यहाँ पे कंडीशंस ये थी, आपने बिल्कुल पे ध्यान दिया और बिल्कुल जा रही थी, आपने मुझे कुछ भी नहीं किया. So that thing they develop their decision making capability and they will learn by that. Next. Need of simulation in nursing, that is the current digital era. These that are clinical enhancing the clinical competencies without risk to the patients, because we can not work on patients without doing anything. We cannot harm the human beings. So we are not allowed to do that leaders on the human. And now all the patients are well, and they will ask who are you? Are you trained nurses? Are you trained doctors? Who are, because they are paid. The hospitals you cannot go and treat them. So they will learn. So this is just need of ours. That's just we are able. Addressing the care and the clinical placement before going the clinical, we have to assess the even the trained staff nurses also to be assessed when they will allow to the certain areas where they have not worked previously. So we can assess them by these suggestions and make them the competent enough to treat the patients. Promoting clinical training and decision making, then integrations with digital tools and visual reality. Then support the lifelong learning and new education and repeat these processes again and again as per the requirements. And one more thing, but as if you will see the nursing care, even for the PSC analysis, we define if any officer, the students will not competent 100% till now he will repeat that exercise again. So that skills is supposed to be required before the basic officers is supposed to be required before going to the theoretical areas. So same thing in the services they can do here again, they can allow their on these high maintenance or standardized spaces where we do not have high maintenance in the colleges. They can then the task areas or the standardized spaces can be used. They can act as a high maintenance. They can develop the students and they can be trained. They can be the helpers in that necessary and we can train anyone for that to make a standardized spaces. Next. Introducing success on the destination is curriculum. The competency traditional learning simulation is very efficient and it is systematically integrated and internal elements of the curriculum of the training programs. It should be integrated into the existing curriculum that is there now. We have to increase more and more in the designing the simulation labs. So it is a basic task. All the colleges not have the big simulation lab, but as now in recent curriculum also they should have an advanced nursing lab with certain task areas. So they can teach these students best education, and that's why the international council is designing teachers for this benefits. Then simulation schedule and assessment. Only the important things how to make these schedules. To that proper scenarios to be made to given the students and all the scenarios have the checks. They have for every process we have a checklist. The teachers or the task have a checklist there and they will just observe the students what they are doing. If they are doing right, so then tick mark twice. Wherever they say they will make their course. So afterward they will discuss with them we solve. So that list you prepare properly with all the sources and can use. Next. This is important process of simulations. Take place. Pre-brief and scenario and debrief. Pre-brief and scenario are experiential learning and the debrief is active learning what we have done. So this is the whole simulations. Pre-brief and scenario is created by teachers who train in the simulations and they will before starting the procedure they will give the situation to the students and the scenario will be handed over to them. In our way, we have one way glass mirrors. The student cannot see the teachers. They are in the different sides. So now as the students are there in the library, no one is there to see them. Because the teachers are there, they are always afraid to do wrong things. They are afraid if I will do something wrong, the teacher is for being guilty me. So they will not perform properly. So the teachers are behind that class and the students are performing based on the scenarios given to them. And in that scenario, whatever they are performing, another room they have the control of the high ability managers. If they are performing there, then it is okay whether they deteriorate the health of the high ability managers. Like that. So after that, they will all sit together in brief basis. And then they will start discussing from point 1 to end the procedures, what you have done. Where, why you have taken this. They will not say whatever you have done is wrong. No. They will discuss another whether why you have taken this decision. You can take an advanced decision. So they will ask the students only about the replies, how they have done. And that only the new they will learn more. And they will show their pictures, their videos, their voice and everything wherever is required. And that's why we will learn more. And they completely discussing again and again discusses can be able till they will perform well. Next. Key components of the semester is high management. Like these are like models which is psychological responses such as breathing, heart sound, and they think it can like a real home. Standardized sessions that can be any person, any student, they can make a standardized session, any other staff or the helper in the labs can be trained for this standardized session. They will get and they can respond. So when they are going the clinical house, we will ask the street to the patient to start off and everything like that history is given by the standardized session. They are ready आपको hypertension से किस बताना है तो उस पेशेंट को क्या बता जब भी नर्सिंग स्टूडेंट को एक्सरसाइज करेंगे तो उसी तरह के बताएगा मुझे हाइपरटेंशन क्या है तो इस तरह के साइंस सब आ रहे हैं तो साइंस से पेशेंट्स कैन diagnosis departments the nurses diagnosis or paramedical diagnosis. Visual sensors learnings can be created in based on these things. Next. Types of assessments for different tasks these are available. Most of the nursing schools they can purchase some more. These are specific skills like IID sensors and characterizations can be learned on these tasks. Small tasks can be easily and they are the low cost. Then high fidelity management is variety of levels dependent upon expenses and cost. Medium, high fidelity and low fidelity managers are available. Hybrid simulations that's the combination of the both the task and the standard patients. There they cannot process the high fidelity managers when the task runners and the standard patients can act as a high fidelity managers. So by that they can replace with the low cost. Then visual next. So these are the tasks like this. These are the food managers. So these are the tasks that students can learn certain procedures. They can repeat again and again. They become the competent with the help of the students wherever required. Next. High fidelity management. We can have many procedures like CCR, bandaging, injections, and we can even show the surgeries on these managers. We have already, we can train them surgical procedures also with these high fidelity managers. Next, even though burn stations, how it will look like, accident case, how it will look like, that all things can be made in that super area and shown to the judges. Because many of the disease conditions we cannot see in routine hospital postings. That can be shown in that suggestion-based case. The medium faculty management also again heart sound, your speech and suggestions, vitals and everything can be recorded on that. These measurements are really hands-on learning for the CPR, trauma care, critical care, helping the learn and practice the skill of assessing and control environments. Next. The low faculty management can be used for the non-impact training models used for the healthcare for education-based practices, fundamental skills. It does not simulate the real psychological research, but useful in the procedures like positioning, injections, and care. So like these procedures, we can use these low faculty managers for the training of the students. Next. Hybrid simulations, like we already discussed, the hybrid simulations can be used with the task trainers and the standardized patients. Where the one can be the standardized patients with the small task trainers and can perform. Because we have high fidelity centers of the delivery of the labels can show. But we have also the small task trainers where the one person can be the standardized patients and with the help of the task trainers also we can ease they for the different labor sources. So both can be hybrid systems. Next, standardization. So like that we can make the standardization can be made for processes and can be realized easily. And that can be the student nurse, that can be the any other staff member or the helpers. We can have for class of our departments, and they can be the standardization for the processes. So next, we are visual simulations. Now it is worked as like 3D simulations. So a hospital department can be created in the VR and that can show the students really before entering the hospital how it will functions, critical areas, ICU or other areas, how that are performing, all the processes can be performed. That 3D surroundings by special device with the sound, with the patients, and everything can be students. So that's before because whenever they enter the hospital, the students have always how society is like that. Because you will go in the emergency, there are accidents. So how they will first time they will see these type of the situations in real life. So by the 3D simulations, but we can show this hospital will be like the assistance you will get the accident bodies, any type of cases. So they should be prepared for those conditions and they can take proper decisions. Next. So simulations will help the student to learn by reflection, practice. These all the ideas of the simulations we are discussing in previous slides. So reflections is a more important, but they will learn and that again and again discuss with them, make them proper decision making capabilities. So minimum errors can happen in the theoretical areas. Next. So benefit of the simulation education digital era for medical health. Enhance every small for the nurses, doctors, and hospitals have one for the is more important. So successfully can be enhanced by this simulation training and realistic clinical training. They can learn skill development and masteries by these simulation based procedures, the nursing diagnosis and decision making capabilities. Then immediate feedback and the evaluations can get done. Because we have exercises, so we know their evaluations. We are doing the briefing for their evaluations, which means that segment is ignored. After 3 days, 5 days, बाद में बताता है कि आपको रिजल्ट मिला था 10 से 5 मास तक के सामने यहाँ पे नहीं करना होता है। जैसे ही आपने सेशन किया, आपको डिप्रेशन से जाना है, आपका रिजल्ट नहीं प्रिपेयर है या जो भी आपने प्रोसीजर्स किए हैं, चेकलिस्ट साथ में किए तो चेकलिस्ट आपको बता दिया जाता है कि which state to have this out. You have not performed properly. So you have to repeat it. So they have to repeat it again. If they will repeat it, then they will be competent on the procedures. Like that. The errors can be happened this, and if we have the environment, every lab is like a hospital, and all we have to in all the areas before doing any start. Whatever we will be teaching them in 30, they have to do that process. They are in simulations and those processes, conduct processes. After that is the checklist. So they cannot miss anything. Next. So these are the most essential things: crisis management, decision making, learning skill, and refreshment process. There is need of the continuous education, and refreshment process can be done again and again for the students. Next. So students assess global risks and accessibility through digital era in the education assessment worldwide, breaking geographical barriers, online simulations, and the opportunity to study remote areas in regions in high quality education without the travelers. So we are visualizing high aspirations can be more serious where they can teach because also one center is another student, another college where they are by this so we can provide that. Then equipment learning opportunities, online platforms, learning from diverse socio-economic backgrounds to assess the same learnings and learning experiences, reduce the discrepancy in the education quality between the countries and the regions, and scalable education. Everyone has the same opportunity to show and the same level because we are doing with the checklist, so that checklist for every student is same. It is not we are just observing them and ask we give the marks. We have the checklist and based on the checklist marks we give. If they miss one point, so one marks will be rated. Whatever the decided 1 point is 5 marks, so only 0.5 marks can be rated. And there they have to be. So evaluations are also proper evaluations can be scheduled for every month in the specific. And all the students have to able to do the same process. Next. Research evidence-based practice in simulation education and learning. So what on the basis of the research, the outcome is defined, expected outcome should be clearly defined and evaluated. So whatever you will decide, what should be the outcome that we can achieve by the simulation-based nursing education. Distributed practice, short, repeated sessions help the maintain the competency and improve the performance, clinical variations, then facilitate debriefing and varied students. Facilitate debriefing have the reflections which enable long-term learning. Next, the major challenges one is the the high academic medical students have bigger amounts to spend, but we can have the alternative over the low task trainers with the standardized that can be done. And then the instructions, trainings, and the competency. The trainers also be competent enough to teach them. And it is also another thing is the interdisciplinary. Wherever medical nurses and paramedical folks are running in group competitions in one group, under one group. So there what we do, we call that MBBS students, PG students, nursing students, and paramedical students, and give them the message. So everybody will perform their own roles. Not one that we will make a nursing student, one doctor, one senior nursing officer, junior nursing officers. But wherever there are the medical institutes, like we have medical college, nursing, physiotherapy, pharmacy, and allied health business. So we will make a team of the students, and then we will get the specialists. So where the teachers from the nursing, from the medicals, together with the specialists. So like interdisciplinary education can be more effective for the specialist scenarios. So we can do that also. Together, because in hospitals we have to work with all the team. So same we are doing the simulation-based nursing in our areas. Next, there are some research evidence how these high faculty and medium and hybrid solutions will benefit empowering the medical students filling the gap in high faculty solutions. So what is the key finding in the education is the impact of the advanced life support simulations on the self-efficacy of the highly medical student found significant improvement in the self-efficacy percentage to the CPR performance and low. So these are the studies in that and they show this simulation-based education is helpful and the result of there is significant. Medium and high benefit. These are some studies that you can take the pictures or you can search on the website what is the result of the simulation-based education. So these are good journals in these studies are published in CMC our PubMed. One study is 2023 global meta-analysis. The technology enhanced simulation significantly improving the clinical skills, knowledge, performance in the higher care academy. This is the strong impact on the simulation based on the higher care competencies, and the studies say 50% of the success can be teach to the students. If you can change, now Indian Nursing Council said 25%, but it can be up to the 50% can be changed in the students' learning. So like this is another studies are there. These are all our studies. All the studies will show their impact. The traditional impact can be changed to the students' and everyone should train for that. That's like this trends are going. The results from the organization to plus 2 for trainers, 2 for training, 4 teachers are trained by the simulation and that teachers are trained in their effects and that effect again can teach the students. So that is the motto behind the national students. Next. So these are the references of these journals on the last slide. So this is helpful for the students and not just the students, also for the faculty and even though staff nurses, we can train them for the students as well. If you have any questions for this, you can ask. Thank you.
Thank you very much, sir, for sharing your deep knowledge with us. The session was full of enthusiasm and valuable knowledge. I request Dr. KHARGAHR ma'am in appreciation to Dr. Sunil Kumar Nilas.
Thank you, sir. It will be my privilege to invite our speaker for this session, Dr. Bharati Ma'am. Ma'am is currently working as an officer in charge nursing department at KHARGAHR September. She has completed her BSc and nursing from Medical College of Nursing, SSC University, Mumbai. She has a professional registration of Maharashtra Nursing Council. She has a membership in the Professional Organization of Trade Nurses Association of India, Asian Association of Cardiac Nurses, Oncology Nurses Association of India. She has published many post-presentations and access paper presentations. She has published paper publications in journal. She is the author of the chapter Medical Surgical Nursing, published by Trade Nurses Association of India, New Delhi, 2013. Ma'am is speaker in workshops and conferences. She was a member of Continuing Education Committee of TNA New Delhi for 2015 to 2018. She was elected as a Director of TNA 6 branch for 2013 to 2017. She is elected as a Director of TNA Maharashtra State branch for 2018 to 2023. She was a member of Board of Studies in Nursing in National Institute of Health Sciences from 2012 to 2017. Ma'am was examiner for BSc Nursing, MSc Nursing, and MPhil program Institute of Health Sciences, Navi Mumbai, and SMT University, Mumbai. She is a Maharashtra Nursing Council's support speaker for continuing nursing education. I request Dr. Supriya Khan to participate Dr. Bharati Khan. Over to you.
Good afternoon. Little loudly. So I continue what sir has said, and before that, let me thank you always, Dr. Shailaja and Dr. Supriya, for calling me here for this hearing. I actually look forward to this hearing to meet my old friends. So I can see my friends from Tata and friend from KHARGAHR and other hospitals. Thank you very much. To begin, I'll ask a question. You all know us? There are 4 rhythms of cardiac arrest. 4 rhythms. I think this question because of rhythms of cardiac arrest. Little now. A stone. Pulseless beat. Somebody saying here third. Ventricular fibrillation and the fourth one. Not atrial fibrillation. Somebody said here just now. I heard that word. We said BD, pulseless beat, base, stone, but here. कौन सा सब pulseless absolutely. In our experience, we have encountered cardiac arrest, all of us. How many times we have come across PEA? How many times we have come across PEA? Pulseless experience बदल जाएगी. No problem. Those working in ICU center, they might be experiencing it multiple times. Anupam. But people who are outside have not experienced that. And if I talk about students, बहुत rarely they judge. So if I really want to tell students what is PA, I don't mean what tell me. So the best scenario is simulation lab. And a beautiful simulation lab I experiences, जहाँ पे the ECG is changing as the way that paper wants it. Am I right, sir? And even the heart rate changes, and they wait for the students or the candidate to act upon it. Say example, student is taking time. होता है ना, students take time. The student is taking time. What next step going to do? और maybe वो 5 मिनट में चला. So what will happen to that SPO2? When I am teaching in the classroom, I may say that patient's SPO2 is dropping. But in the simulation lab, the students can witness dropping the SPO2 if I am not acting on it within that given time. So what students will understand more lifetime experience कि मुझे ये जल्दी आएगा decision. I clear. So simulation lab is Sister KM, you are already from KM. So every then 4 AM, I got TDS. How many times the current generation is get an opportunity to learn something called as high power? How many times they are getting? You can raise your hands. One hand. They are not getting the opportunity to learn something called as high power watch. DII, we give you anima first, and then go on giving that high power watch to capitals. All of us remember. But if a generation is not getting the chance, I need to give them the chance. Why I am saying again because we say the culture is pass on. Obviously, one generation to the next generation. If I don't give them the opportunities, they will not be in a position to understand. I'll give you a simple example of what is there in data, what I went through. Vagina dish. कितना बार दिया है student? दिया है very rarely. But RT requires it. They require vagina dish. Or suppose I have signed competency science होगा because their staff has to do vagina dish. Procedure which is mandatory for us as an attention for radiation therapy, a particular disease. Am I right? So there are certain things which I cannot get the opportunity in the clinical area. This is the research. Clear? Now today you are here for offline. This was the first part what I told about online CA and digital platform we do require. But there was an era when we always practiced COVID. Agree? And then did we stop studying COVID? No, we stayed away. The moment which COVID taught us was online. We all did online. We had CCDs online. The CCD was named as CA. It was online. Why did somebody feel the need to stop that online? Abhi hai online? Hai. But we prefer of what is it? We all are part and parcel of that online training. क्या करते थे? चाचा करते थे और अपना काम. And sometimes it happens when the video is on, the whole audience is able to see what you are doing. Some people are looking, some people are doing some work, some is traveling, some are traveling. Everything was visible. But the moral of the story was what? That CCD or CNN was meant for learning, but we utilize it only for getting your answer. Was it? It means what? When there is a change, when there is a digital era, I take a disadvantage. Everything is not bad. Digital is not bad. There are challenges, but the way I utilize it makes it different. We must be also having a study online और बीच में उठ के कहाँ जा रहा था और मैं what will you do? Today's kids are much smarter. उसको minimize करके and then they start YouTube. That was done by kids. There is people are already getting in like that. So it was done. So people do take disadvantage of what is digital. We also think. So today, with this topic of what all of us, you are listening this morning, how digital health is important, and we are going to see what are the challenges in digital health. Yes. You have done this all. I just going to give digital health care for me is whatever instruments I use, digital instruments, and the services what I use in the health care we mainly as digital health. Now before I attempt to move to next slide, what are those equipments what we do after we handle every day in our clinical scenario? Digital equipments or digital yes. digital thermometer. Just one simple example, digital thermometer. Next, I need one. Now, pulse oximeter, weighing machine, PMP apparatus, Omra, there's a what else? The multiple things are there. As the patient enters the hospital, we start with all the others. Till he goes out. We use app-based feedbacks. We use app-based nursing diagnosis. There's also things what we use. There's something, a core component what we miss when we are using this instruments. Just a simple example is when we use a pulse oximeter. Today, people have forgotten how to take a pulse. Am I right? People have forgotten how to take a pulse. I'm only saying, digital thinking is not right. Digital apps are not wrong. But the way I take disadvantage of it is wrong. So today, when people come with the watch, people come with smart watch. They know that very well. और स्मार्ट वॉच में हार्ट रेट कैसे लगेगी तो भगवान ने लिखता नहीं है किसी किसी में रहता है और जो पीपल आंसर यू नो क्या आंसर किया नहीं पीपल आंसर मेरा जो है स्मार्ट वॉच निकाल के पेशेंट के हाथ में लगा I am not exaggerating or saying wrong. They are messages for me. They are messages for me. That is to anybody comes and joins us. We first look at whether they have this second-hand watch. We are not rudimentary, but you can use a smartwatch. People should be aware of how to use smartwatch. So smartwatch में एक stopwatch है ना, stopwatch. People should be aware of it. And people give me answer कि मेरे ये गाना और वो basically इसमें लगा. That's not clear. So what I am trying to tell you is people have forgotten touched what was there. And that is basic challenge. What I as a nurse feel that we have forgotten, we attach an instrument and then go. And that's the way how people are living. We need to overcome these challenges and that's what we are going to see today. Next. There are many things what we have seen today. What of part of digital that I don't know doing. Next. This is just an example of many more things what we use digital. Next. We are going to see what are the challenges. Implementation of digital intelligence. I've just listed some points: technical, organizational, regulatory, financial, patient centers. I want you to contribute because we all are the leaders. What challenges you all face? Somebody? If I say something, you say digital health in a more area, what would be the challenge? There are some part in Maharashtra still doesn't have internet. They do not have internet. So that's a problem. What else? Absolutely right. Electricity supply. Biggest problem in our country. Where the shutdown of 2-3 hours and then what else? Train will understand. As I was saying, simulation lab is good, but a person who is going to operate that should be good, having a good clinical experience to set up, to modulate that scenario for the students so that they learn things. So if there was something that was a training, yes, anything? Absolutely right. That's one of the problems that trained health professionals will not want to rural area. If health professionals do not go, it will be difficult for a technology also to follow. Absolutely. Anything? Okay. So let's see what's different. The first one is technical, as I said, data security and privacy. Protecting sensitive patient data from cyber threats. There is still still worried to use GPay. Am I right? There would be people who must have not even installed GPay. There would be people. है इस crowd में नहीं है. Wonder. What are you that worried? How does that scam happen? Hack your password. Now the basic thing is the password also something which is very in the phone. That's one. Second is we keep passwords that simple. You are best example. In Tata, we all have our CC number. And our users number is our CC number, and our password is our CC. And CC number, everyone knows. What is your CC number? Getting answer. What else is our password? Either my birthday, sometimes people do know. That's one. What else is done? I give our example. In our hospital where we have an EMR, and where we use EMR for everything. You are also not using it. EMR opens with your personal password ID. Now what happens? Ideally, when I open EMR with personal password ID, once I go out of that place, I am supposed to log. But we keep it continuously on for others to log on to my password. And then these scams will happen. The same thing may happen everywhere. So this protection has to be good. And all the hospitals have come up with some policies to avoid this kind of scams. Interoperability between two different health systems, like if you want to use some data, for example, if a patient is there in one hospital, say example data, and I want to send the patient to another hospital. If everything is online, it might be difficult for us to pass on this information to others through a system. How do you pass on the information from one hospital to another? It transfers your relationship. So the systems, the software that may be compatible with each other, we will be able to send data across other hospitals. And the best or the most challenging part in us is the hardware. When somebody says we want everything online, then it becomes much difficult. A time came in our hospitals that they wanted to enter nursing observation online. I think there is one more where they started. However, for nurse, for everything has to be entered online. We have a good ratio, 1:6, 1:7. But still, 6 patients and one girl has to enter. What are those different challenges what we would face? We require that many computers to enter. And if it is a PC, normal PC, where we keep that PC? Obviously, nurse's station. So what is the next repercussion of that? Which all of us are aware now. The nurses would be at the nurse's station rather than the delivery. And that is the problem still there. Understood? Digitalization, I have to accept, but I need to find some solution by which I need that digital health also. Plus, I will not leave my root that is care and national. Am I right? If a land is there which is going very high up and is losing its touch the ground, how much time it will survive? It will not survive, it will die soon. So when I go up in the hierarchy, in the development, in the advancement, digital and many things, I should not be forgetting my root, that is the care and compassion which has to be done by us. So we are known for it because a day will come and most of my functions will be taken by somebody. Today, as a nurse, I prepare medication. But abroad there is a system called as appointed pharmacy, which will come to us also. तो फिर मैं तो नर्सरी भी बच्चे वहाँ पे टाइपिंग करने के लिए am I right? But no robot, no machine, and no technology can take away care and compassion which only I can give my patients. So the moral story and take away message from here is I should not be forgetting care and compassion. That's what I did, for which I am known as a nurse. Next. Challenges in organization, that is change management. जब भी कोई change आएगा तब people start resisting कि हम कोई change होता है और जब people say ना new generation is very much tech savvy, बहुत fast कर लेते हैं, time लग जाता है. It's normal. So the change handling becomes difficult, and that is the major barrier here. Next is fear and demotivation in interacting and using technology. As I said, there are many people still are worried. GPay charge करने के लिए when online transaction should I do or not? That fear would be there. So I as a nurse or as a administrator have helped them to take out those fears from their mind. Training and support, lack of digital literacy, which we have to do it compulsorily. Lack of consistency and continuous format training. When we start operating things, we get problem. We need that support from our IT team. Lack of time for training and new technologies have led to emergence of new roles for the nurses. That was a challenge, but we need to look at it as an opportunity. And that's what I think about your listeners to that the previous session. There is something called as nursing informatics. So there are people who go for NSC nursing informatics, which is actually a new available for nurses, and people who are expecting that and still go for nursing informatics. Leadership by, where as I said, we also need as a leader commitment so that we go for such kind of health. Certain regulations, what we need to help, because when we EMR, when we use all this technology in the hospital, we need to stick by those rules. HIPAA is Health Insurance Portability and Accountability Act, which is usually seen in the US, whereas in the Indian scenario, we have something called as DISHA, where when I give information, when I put in digital information of patient in the system, the certain information I have to give it as a privacy, confidentiality. Without the consent of patient, I cannot use that data. Next. Cost. Obviously, as I said, we require a lot of software, so we require cost. And when we invest, any management is going to ask how far I am going to get out of that data. Clear? Patient-centered, patient and family needs to be involved in this. There are many things, the simplest thing is a feedback. When we do one QR and they scan, feedback I need to take how to do that. Digital literacy is required among the patients. So there are certain things that they go monitoring. Patient goes home, so we need to teach them how to do that. So many things are there. Patients who have to have a digital literacy. Next. Now the other things, as I said, in rural area, the hospital lab is exists in our country. So for those areas, to look forward for digital health would be difficult. I also want to bring out the disparity in the facilities what we get. In Mumbai, in metropolitan cities, we may have everything. But in the areas where rural cities we lack even the basic needs, where there I expect this kind of things would be difficult. Again, I said, let's medical professionals go there, so I cannot expect people operating in those areas. And that's the reason how government has come over now. When they challenge, there is a solution. How government has come to this now? We talked in the last, let's medical. As an Indian, we work when there is a conflict. Usually, as I do not go to money or service in the rural area, we do not do it. But then government makes it compulsory. If you do not do, pay the fine. Indian health system, there is a lack of network coverage. There are areas where network is there in rural area, but there are still certain areas where there is a network issue. If there is a network issue, we are losing human touch to our patient. Nurses are away from the bedside, and there is a more reliance on technology than clinical observation. And we need to work on this. We see that. This is our scenario is that the technology is going very fast, but the training for the technology is still very slow in majority of the areas. And this is one of the areas where we are getting ourselves acclimated to what is happening in digital all across countries or in the world. Now, however we say that technology might be bad and all that, but something which is changing, going in the world, I have to adapt it. If I do not adapt the change, I will be resistant. And to change that, I have to have strategies to jump from that stagnant water to a fresh water where there is change. If I start remaining in that water again, as I am going to become stagnant and no change is going to be seen. So we want nurses at the bedside. But then I want the nurses to be beside the patient. So then people have come up with something called as STAP, or Tata Hospital has something called as COW, which is not working now. We have COW called as Colonel. Today, हमारा काम क्या है ना? हम we is from foreign country, है ना? And a part is not working, and that part is not available in India. So then the technology becomes stagnant for us. Technology is when we have said inventory control and fall. So we have to take care of that tab, because when the tab is given, वो हाथ से गिरना नहीं चाहिए और कोई लेके नहीं. So that I need to be careful, and I need to be really take care of that inventory, because ultimately it is the one where I am going to give you right all the my patients. So that's what I said. We try and find problems, but we also need to find the solutions. Next. Now, how do I make technology as part of my daily routine? As being said, in the system, we have to utilize. There is no register for attention. There is no register for decision. Everything has to be through system. So, जब कुछ चारा ही नहीं है, and I do not have any other option, I have to utilize this. People automatically start working on this. Data security, as I said. Most of the hospitals have come up with something called as no internet in all the PCs of hospital. They prefer having internet which is only for that particular institute. I think all of us have that system. When I use internet, obviously doctors are viruses, and then this is my system, so we have used this. But sometimes we see only as a nurses we are not able to go with this. Have some repercussion, and that's why this is being stopped. Restrictions in pen drives in the hospitals. Which to use pen drive is a source of virus. It has been stopped. Access is not, or whatever access to me software is not used by somebody else. Amalgamation of old methods with new technologies. I enter the, but now there are some where I write it. So I'm used to that old pattern of writing, and that is converted into the data in that system. So we can have such kind of analysis. So patient and family, I need to understand their level of understanding also. I cannot just pass yes, because for me it is everyday issue. For patient might not be a everyday issue. Next. And as I said, we take it as a challenge. So many people don't understand and go for it. Next. And the best, what we all need to tell that this is again a disadvantage and challenge. That people believe in what is available in Google. People do not understand that there is something called as if you all remember. With the name of our director, the information was needed, include this, cancer will not be there. Our director has not done anything with that. must be there. People who are dead are now speaking. In the sense, उनका voice है, the speech is being. A recent speech by Mr. Balasaheeb is moving. He is very much, but the voice, the modulation is exactly the same. I, as a nurse, need to understand when I get a data, please see whether it is authentic or not. Understood? Because actually there is one politician and a famous personality who said that his wife was murdered by drinking lemon and so on, not taking the name open for. I know the name, not taking the name. He said my wife's cancer was only drinking water with lemon and lime and so and so. Nothing can happen like that. But people will believe and start following that. So we as nurses also need to take the responsibility that there are genuine sites which has to be followed. If they access, say, a particular hospital site where there is a health information, that will be right. Next. Community care, online reports, people are aware. A best example, yes. There was a time the VP had a municipal hospital there's something called a VCTC center. Have you seen? VCTC is voluntary counseling testing. I actually bless some is that's why I know this is in detail. But if my patient's reports are coming online, that's a right, and his rights to be violated. I need to take it as that person also might be worried, family might be worried, their data, somebody else can access this, and that's why we need to be careful with this. Next. Training of nurses on the digital. Most of the colleges started as simulations, training is there. We can go for specific training whenever the hospital gets any app or any instrument may have a training. We need to see that each and everyone attends the training. Next. This is what is hybrid model care. Students had actually prepared a stoma on that manual to look at that patient or a back care to some family member, and the teacher saw it online and she gave the evaluation. So there are colleges who did utilize this for. We are also we can go for this hybrid model of care and training where half whenever you are there. But again, as I said, we as a daily need to take the responsibility and sincerely attend to. That's one. And second, we as an organizer need to take care that the questions are made in such a way that without attending the session, nobody can hear that 100%. After when we all go for that good clinical practice certification online, देखा GCCB. They ask you how many percentage you want for passing. 80%, 100%. So as an organization, make it as 100% passing. It will be released. You understood? There are ways, shortcuts, and there are ways how to block those shortcuts also. So that all can be done. Obviously, this is important aspect that we feedback from the user, how convenient that technology for them and what changes can be done in that technology. Next. Now that was digital, but a company like us need to also work on how to sustain this digital. I cannot say this started because we have a population and everybody is using energy. A day will come that the next generation will be entirely as a need. So I need, if I want to utilize digital, I want to utilize energy, electricity. I need to work on something that this initiative process will be there, we sustain this work. So the first one is transition to renewable energy. Most of the hospitals have got this solar energy. Obviously, in Mumbai and metropolitan cities, we can go for wind power because we are land sources. But there are hospitals who have gone for so many of us have got solar power, and some people can go for wind power. Sustainable digital energy practice, that is, we need to reduce and e-waste. There are multiple ways by which we can reduce and e-waste, that is, use rechargeable batteries, choose product with longer life, preventive maintenance of digital products, handle equipment with care, and reduce use of portable electronic devices. And this brings us to a generation where people believe in changing mobile even every year. And when a new model comes, people want new model. And that is the top of discussion iPhone 10, 15. So maybe iPhone 10 is old and then whatever 11 becomes very fresh, and then when we sell anything, obviously this is going to be a problem. But otherwise, if I am throwing it, it's a lot of things we prefer. Nowadays we prefer throwing. There was a generation chapel is broken, they stitch it, and they use it. But अभी चप्पल टूट गया तो वो डस्टबिन में जा जाएगा. You could go for stitching. I'm not saying you should do that. But when it comes to things or anything, it's as a source. And we all need to learn कि हमारे ancestors ने शायद वो किया, इसलिए हम अभी survive हो रहे हैं. Let's not have a policy of use and throw so quickly. We need to preserve something. Makes sense? And इसलिए शायद you have paid for 1 lakh, but 1 lakh is not sufficient at the end of 1 month. Reduce energy consumption, switch off devices when it is not being used. How many of us switch off lights and fan when we get out of train? Wonderful, good. Wow, very happy to see that. जब जब last station आता है, nobody is there in the train compartment. Let's switch off the light and fan so that we are saving energy for our next generation. Again, the last slide. We need to prioritize person and process over the technology. Again, as I said, nursing tasks is taken by many people. Dietitian, physiotherapist, and so many. But the care and compassion should continue so that we remain here. Next. कितनी सजन में मूवी है ना, कितनी सजन है शादी का तो मूवी है, बहुत नहीं मूवी चीज़ बहुत care and compassion cannot be replaced by चाहे बहुत आ जाएगा, but still the basic concept for which a human being has come into existence as love, care and compassion will not be like technology. Next. What we're saying that love, compassion are necessities. They are not luxuries. Without them, humanity cannot survive. That's my take-home message when it comes to digital. Thank you very much.
Thank you, ma'am, for sharing your knowledge with us. For sharing your session will be very helpful in giving the practice. I request Dr. Sumara Patil ma'am to give appreciation to Dr. Bharati ma'am.
Sorry, I did not ask if you have any questions. No questions.
We will share posts and feedback from in your respective folder and request you also like to do.
acquired information from experience and environment. So whenever we are communicating with people, so that we can identify what are the concepts and ideas behind patients' mind. So cognitive conceptualization is the process of cognitive process of what understanding and explain a patient's problem by examining their thoughts, beliefs, and perceptions. So what are the patient's thoughts and beliefs that based on that form of cognitive conceptualization framework, which is has to identify what's the core belief inside the patient. So it is really helpful to understand the patient. The therapeutic nurse relationship is the purposeful, goal-oriented connection between a nurse and a patient built on trust, understanding, and mutual respect. As we all know about the therapeutic communication relationship, like what are the types, what are the techniques we are using, like listening, broadcasting, restating. These are the techniques which are helpful whenever we want to communicate with the patient. So the cognitive conceptualization is with the presenting problem whenever we are communicating with the patient. So that time we are identifying what is the presenting problem, or like what are the complaints of the patient. Then the predisposing factors like risk factors which is associated with the patient problem. Then the precipitating factors, so the factors which are cause or triggers of the patient. Then habituating factors like the factors which are worsen the illness, and protective factors. The cognitive conceptualization is also focused on thoughts and belief, building a framework, identifying unhelpful patterns, guiding therapy tools and techniques. So the cognitive model and its consumption as therapy. So maybe whenever we want to give a CBT, cognitive behavioral therapy, so before that we want to maintain a good partnership between the therapy process. So again therapy process is based on the different techniques which we are using, like based on the therapeutic nurse patient communication techniques and whatever the CCT techniques we are using. The session process, so again the session is having a time, like before the session we have build up our demo, as well as we can also go through the mental status examination. Then goal setting, cognitive conceptualization diagram, CCT techniques, then reviewing action plan and homework. So whenever we are giving a cognitive behavioral therapy or any therapy we are giving to a psychiatric patient, so in here therapy we are used to give some small tasks to the patient. If the patient is fully doing the task, we are giving some points, or maybe we are giving some reinforcement to the patient. So what happens based on that, the patient is motivated, and again whenever he is enthusiastic to perform another task. Yes. So the cognitive model is depending on the thought, behavior, physical and emotional. So whatever the thoughts we have, based on that these things are dependent. So based on the situation, automatic thoughts and images were created. Based on the automatic thought and images, the reaction is there. So the reaction may be again divided into three forms. Maybe the reaction is emotional, maybe it is behavioral, or maybe it is a physiological. Yes. So before the cognitive conceptual diagram, let's just go the terminologies. So the first that is core belief. Like what are the core beliefs? So the core beliefs are a person's most central ideas about themselves, others, and the world. In cognitive behavioral therapy, core beliefs are thoughts to
underlying automatic thoughts. So the patient is having some motives, like they are sticking to one point, they will not think beyond that. These are the core motives. Then automatic thoughts. So automatic thoughts are the stream of thinking that constantly flows through our mind. They are automatic and pop up or push in one's mind without conscious thought. So when people pay attention to their thoughts, they become more accessible and people can articulate and evaluate it. So automatic thoughts are again the thoughts that comes like flash. Okay, and based on that, sometimes the patient are also showing some signs and symptoms. Then the cognitive distortions. So although some automatic thoughts are may are either untrue or have just a grain of truth. This is also known as a dream error. Sometimes the automatic thought, whatever the patient's which is coming to the patient's mind, sometimes they are true and sometimes they are not true. So that time the thinking errors will happen that we will call as the cognitive distortion. Then cognitive restructuring. So cognitive restructuring is a strategy to recognize negative inaccurate thoughts and replace them with alternative ones that are more realistic and helpful. So whenever we are identifying the patient's thought and whenever we are replacing that thought, that is called as the cognitive restructuring. So here we can see the cognitive conceptualization diagram. So whenever we want to give a cognitive behavioral therapy, so that then you can just go to the, or maybe you can prepare your own diagram, so it is easy to give a cognitive behavioral therapy. So relevant like this, whenever we are taking the history, that time we will ask the patient like what was past psychiatric history, psychiatric history. So based on the relevant like history, we will identify the core motives, like what are the core beliefs, and based on that, we will make some assumptions or beliefs, and based on that, coping or complementary strategies we can use. So based on different situation, automatic thoughts are that we have to identify what is the meaning of automatic thoughts, and based on that, the emotions and behaviors are different. So the cognitive conceptualization diagram is mainly associated with the cognitive behavioral therapy. Yes. So whenever we are doing the cognitive behavioral therapy, then we can also make the cognitive behavioral therapy worksheet. So in that code number, like inside we use to maintain a confidentiality. So that then you can also go for the code number, your whenever you are giving the CBT, because the CBT is once you cannot give a CBT, you have to give in a specific interval time. So that then the situation you need to identify like whatever the conversation between the nurse and patient, and whatever the situation is there, based on that you have to identify the automatic thought as well as the emotions, like whether the patient is anxious or whether he is sad, whatever the emotions is there, that you have to identify and that you have to mention. Core beliefs again you need to identify, and based on the core beliefs, the automatic thoughts you need to see. So the automatic thoughts like all or nothing, okay, so all of nothing, these are the certain cognitive behavioral techniques that you can use, and based on that you can identify the outcome. So this worksheet we can use whenever you are giving the cognitive behavioral therapy. So these are some of the references which I used for this paper.
Thank you, ma'am. Now, I request Dr. Supriya Khan to give appreciation to our acknowledged observer, Dr. KHARGAHR. Thank you, ma'am. Now the conference has come to the end. Here I would be very much delighted to invite Ms. Joshua Papale to propose the vote of thanks.
Hello, very good evening, everyone. First of all, I would like to request everyone to join me in a big round of applause. So, for this, Chair will have introduced by my system. I know I stand between you over here, but before I let you go, I will failing my duty if I don't thank you everyone who helped put this conference together. So, enjoy for 5 minutes. Distinguished dignitaries, conference participants, all of us knows that the stars on shoulders of joy, but clearly that we look back and see how they have contributed and effort. Here I am to welcome this opportunity to say heartfelt thanks. See, the growth over the year is due to a good system established and the independence and flexible services. So thank you. Chairman Dr. J. Sir, Trustee Dr. Kavita Ma'am, for this unwavering support, inspiration, and encouragement for this conference. Second, our heartfelt gratitude to our principal, organizing chairperson, Dr. Shailaja Jatati, for believing our vision and standing by us at every stage. Your presence and added significance for this conference. So I think all agree that any conference probably cannot success if you don't have a good speakers and delegates who are traveled over here to deliver the ideas and today's and one. A big thank you, Dr. Shailaja. Your focus and highlighted how digital terminology terms using and verifying using capabilities in digital area. I would like to Speaker Dr. Suresh Sharma, who shared knowledge, how to have necessary for enriching knowledge and positive effect in a clinical practice by using different technology as a standardized language in a healthcare system. My heart gratitude to Speaker Dr. Rajesh Kumar, who brought depth and perspective to the session with knowledge, experience, and research towards transferring nursing care, digitalization, revolutions in changing upcoming nursing professions, and also giving us a good perspective of this. Thank you so much. Thank you once again. A big thank to another speaker, to Dr. Sumini Dularas, for again carrying digital area and simulation-based education is a revolutionary powerful tool that allow individuals to practice skills without the consequences of the real world in the nursing education medical area. So thank you sir for this great session. My thank Dr. Bharati Ma'am. In fact, ma'am, we are considering you as a part of the Foundation Institute of Nursing Education as a student family. So you always been very supportive for this conference. Thank you very much. A special thanks to the organizing committee and volunteers, Dr. Supriya Kadagama and Preeti Naima and our college license officer, Jay sir. Your hard work, dedication and flawless execution ensures this event run smoothly and thank you for your efforts. So thank you all of you and I like to thank who are here. They have contributed their efforts to me as technical support, the decoration committee, all the association members. Thank you all of you. And lastly, thank our dedicated participants. Thank you for your participation and your enthusiasm. Thank you all of you. Thank you once again. Have a safe journey.
Now I would like to request all the delegates to be stand for the national anthem. Thank you for your attention. Let's end this session. I request delegates to come for photo.
देख देख इधर से चालू एक घंटे से पहले ऐसे मेडिसिन ले लो। देख इधर ये चीज ये ऐसे ले रहा मोबाइल पे आगे सर एक मिनट मैम